ठीक आहे ठीक.
If you believe 8 to 10% salary hike is
All the delegates, kindly be seated. We will be starting the sessions shortly. Shall we start? अच्छा ये नहीं मेरे मैं पैसे नहीं दूंगी मैं तो पैसे नहीं मेरा फोन आया 1+11 आ रहा है सर आप दिख नहीं रहे हो आप नहीं आपके स्टूडेंट्स नहीं आओ आ जाओ Education is the passport of the future, for tomorrow belongs to those who prepare for it today. The purpose of learning is growth, and our minds, unlike our body, can continue growing as we continue to live.
Suprabhatam Shubhodaya, and welcome back to day 2 of the National Homeopathic Conference, Homeo Healing Voyage, a journey towards excellence. We know and we hope after an exciting
काय काय
day of
होतंय
learning, we know and hope after an exciting day of learning, we are all set to experience intellectual journey from the eminent speakers of today.
As we begin with the session for today, I now invite our resource person, Dr. Praveen Jain, Sir, Chairman of the session, Dr. B.D. Patel, Sir, and Co-Chairman of the session, Dr. Swarupa Patil, Ma'am, onto the stage. I request Dr. Bhavna. I request Dr. Bhavna to welcome our guest with a flower. I request Dr. B.D. Patel, Sir, to welcome our gathering.
Shubhodaya. Good morning. This is what India is. You speak in seven seas language, you will understand, but you don't understand our own language. Let us have one more time. Shubhodaya. This is what it meant. That means Dr. Uduchankar sir has provided first class breakfast. Are you happy? Friends, yesterday we had wonderful sessions, some technical sessions and some academic sessions. Let me tell you, today we'll be having only technical sessions where you will learn many things, and when you see people presenting cases, understand them and use them in your practice. Even if you cure one case with that, all the way you came from here, everything will be fulfilled with that. One case, one tip will help you in practice, and that will increase your practice and confidence. Friends, so the moment session starts, don't go away. If you go away to attend natural calls, come back, sit, and let me assure you, you will have a wonderful day. I'm sure that you had wonderful sleep at the night. क्या बात है? Did you sleep in the night? No, only few people are saying. My boys are not saying. Did you not enjoy the wonderful dinner? Did you enjoy the dinner? It was like a marriage, what do you call, a reception party. Wonderful music. I was never hearing the dum music. Smooth music. Everybody was enjoying. So with that spirit, let us start today and say very much thank you for Dr. Udchankar and KLE Society. Should we not applaud them? Thank you.
Thank you, sir.
Thank you, sir, for the wonderful welcome. I request Dr. Rinku Porwal to introduce the chairman to the audience.
A very good morning, one and all. It brings me an immense pleasure to introduce Professor Dr. B.D. Patel, sir. Sir is a former principal. Sir is a former principal of Government Homeopathic Medical College and Hospital, Bangalore and Chandigarh. Sir is a former director and dean of VM Homeo Medical College and Hospital, Salem, TN. Sir has been into corporate training, especially youth. Sir is former chairman of Board of Studies, KPSC member, advisory committee member Ayush. Sir is very good at public speaking in various forums on various subjects. Sir has trained many students in RYLA program. Sir speaks multiple languages like Hindi, Urdu, Kannada, Telugu, Marathi, Gujarati, Tamil, Malayalam, Punjabi, Marwari, Bhojpuri, Bengali, English, Sanskrit, etc. Sir has recently received Adhyatma Ratna from NTR 100 Birthday Celebration Committee. Sir is a recipient of multiple awards, naming a few. He has received an award of Dr. Hahnemann Memorial National Award, Living Legend Award by Homeo Friends, Gorakhpur, Excellence in Homeopathy by Homeopathic Science Congress Society, Uttarakhand, Lifetime Achievement Award. Sir is a patron of KQHDA, Karnataka Qualified Homeopathic Doctors Association. We deem it an honor to have you here with us, sir. Welcome, sir. I now request Dr. Jessica Monterio to introduce our co-chairman, Dr. Swarupa Patil ma'am.
Dr. Swarupa Patil ma'am is presently the in-charge principal of KLE Homeopathic Medical College, Belagavi, and HOD of Organon of Medicine. Madam has a professional experience of more than 30 years, out of which 15 years as honorary specialist in homeopathy in KLE's Dr. Prabhakar Kore Hospital, a 2,400 bedded multi-speciality hospital in Karnataka, India. Ma'am has many research publications and presentations and ongoing integrated research on warts, published several scientific articles in international journals, presented posters in international conferences, including LMHI Global Curriculum 2021, presented paper in Second International Ayush Conference held in Dubai in Jan 2024. We are glad to have you here, ma'am.
Thank you, Dr. Jessica. I now request Dr. Swarupa Patil ma'am to introduce our guest speaker, Dr. Praveen Jain sir.
Good morning, one and all. Today we'll start the first session of day 2 with a very eminent speaker, Dr. Praveen Jain. Dr. Praveen Jain is a highly esteemed homeopath with an impressive career spanning 29 years. He has gained widespread recognition for his exceptional expertise in two key areas, autism and pediatrics. With unwavering dedication, Dr. Jain has established himself as a leading authority in homeopathy, providing unparalleled care and treatment to his patients, ensuring their well being and overall health. Leading the acclaimed Homeo care, Dr. Praveen Jain has been instrumental in attaining the distinction of being awarded as the best homeopathic pediatric clinic in India. His profound understanding and research have equipped him with the ability to tackle complex genetic diseases such as DMD and Down syndrome, setting him apart as an expert in his field. Beyond his clinical practice, Dr. Praveen Jain's accomplishments extend to the international stage. He is widely recognized and respected for his captivating seminars and his ability to simplify intricate concepts. Through workshops and guidance, he has played a pivotal role in empowering fellow doctors to achieve success in their own practices. His authored books, including a renowned reference text for doctors pursuing an MD in pediatrics, serve as a testament to his authority and wide recognition within the medical community. With 5 influential publications in homeopathy, Dr. Jain has become an indispensable resource for aspiring and practicing homeopaths alike. So, with this, I present to you Dr. Praveen Jain. Thank you.
Thank you, ma'am. I request our speaker, Dr. Praveen Jain, to please step on the stage.
Shubhrabhat, my chairman, Dr. V.D. Patel, has been influencing me since yesterday to use more and more of Indian language and Indian culture. I thank you, sir, for this. And also thank you for your motivational introduction for this particular seminar. I'll try to implement whatever you have influenced me since yesterday. I also thank my co-chairman man. Thank you for these kind words. Thank you, Dr. Uchankar and the KLE Homeopathic Medical College for giving me this opportunity to share my ideas with you all about pediatrics and one of the most challenging topics of pediatrics. Today, what I am going to share with you all is the most challenging topic in our life in homeopathy, that is genetic diseases. I remember my teacher, late Dr. Praful Vichekar, used to say that where allopathy stops, homeopathy starts. And these inspirational words and his explanation has inspired me a lot to work on this difficult and challenging topic that is called as a genetic disease. So friends, what are genetic diseases? If you list few genetic diseases names, we have Down syndrome, we have Duchenne muscular dystrophy, we have Marfan syndrome, Fragile X syndrome, Klinefelter syndrome, Turner syndrome. Now these are the diseases where allopathy has got almost no scope, and also homeopathy, when I was in school days, my college days, we were told that homeopathy does not have scope in these diseases. But my guru, late Dr. Praful Vijaykar, has inspired us, and he has shown wonderful result in such cases also. So based on his inspiration, I started working on these cases. I started understanding these cases. And today what I'm going to share with you all is an basic understanding of how to understand these diseases. We'll see what is the scope of homeopathy, and my aim and humble request to all the students here is that believe homeopathy is the most modern ultra science which Dr. Honeyman has given to us. The scope of homeopathy is limitless. The scope of homeopathy is homeopath himself. So if we believe in us, then we can give wonderful results in so-called incurable cases and so-called genetic cases also, provided we understand what Dr. Honeyman has given in his aphorisms. If you try to understand the aphorism and imply that, then the scope of homeopathy is limitless. So I call this as genetic care, genetic wellness through homeopathy. Now suppose this case comes to you. This case comes to you all. If there's a genetic case in front of you, what are we going to do? How do we understand and manage these diseases? What is the first step which we will take? How will you decode the history? I would like the audience to participate, because only when we participate, then we can understand things better. So what is the main thing which we see when we see a genetic case? What part of the history do we take? How do we approach these cases? Yes? Anyone? Mother's history during pregnancy. Very good. So how do we approach these cases? We take mother's history during pregnancy. This was again a very important topic, that mother's history during pregnancy is very important, and very important in pediatric cases. And when I started my practice, this was told to me that whenever you see a child, you take the mother's history as very important aspect of case taking. Slowly, when I started going details into this, the first question which came to my mind is that why not father's history during pregnancy? Why do we always say that mother's history during pregnancy? Why not father's history during pregnancy? Is not father a part of the child? So these were few questions, few funny questions which came to my mind, and I was always wondering that what is this why is this only mother's history is important and father's history is not important? Somebody said that give specific remedies to these cases, like if you see a case of Down syndrome, give Barata cup. If you see a case of DMD, give some anti-miasmatic or some specific remedy, rust talks. But friends, believe me, such specific remedies are not going to help in these deep-seated cases. Specific remedies can help in psoriatic cases like asthma or psoriasis or skin conditions, eczema. But when you want to prescribe or do some changes in these genetic cases, something more has to be given. Somebody said that take the child's totality. That is what we used to do. Take the child's totality and prescribe for the case. But in genetic cases, I found that this system does not help. We all, as a practitioner, have these cases. I am not saying that I am the only one treating these cases. Everybody has got these experiences and cases in their clinic where they have given good results, or at least they have made the quality of life better in these cases. But friend, this is always an hit and miss. Same with me. When I started my practice, it was hit and miss. Patient आया, दवाई दिया, ठीक हुआ तो हुआ, नहीं हुआ तो उसका नसीब. So there is a lot of uncertainty in homeopathy. And today my sharing of this presentation will be to remove this uncertainty in homeopathy. Everybody has got these cases. हमारे पास सबके पास डाउन सिंड्रोम के केसेस है, डीएमडी के केसेस है. In fact, I'll say that you people must have got more cases than what I have seen. But it is always hit and miss. And we should, whenever we see a case, we should be confident enough that yes, this is a case in front of me and I will be able to help this case. That uncertainty, which is quite popular in homeopathy, the law of individualization has to be removed. एक ही patient, when he goes to 10 different homeopaths, everybody prescribe a different medicine. Why? Allopathy में जब जाएंगे, patient जाता है तो उसको, if he has fever, paracetamol. But when we have cases in our clinics, every homeopath gives different medicine. My question is, why do we do that? Why can't be there certainty in homeopathy? So we have to bring out systems in homeopathy. We have to formulate system and systematize homeopathy so that everybody gives the same kind of consistent result across. Disclaimer, I am not a genetic expert. When I am on the stage, I am going to talk a lot of Down syndrome, DMD, and a lot of things. Once I come down, don't ask me this. See, I am not a genetic expert. Neither I claim. I am going to just share my understanding that how little changes in my practice has improved the percentage of results. Nobody has got 100% of result. Even I don't have 100% of result. But the aim of every homeopath has to be that his percentage of result should improve. As we grow, as we understand newer and newer things, our percentage, suppose today you get 20% of results in your clinics, it should improve. So my aim here is to help you out to understand and improve this percentage of results. And the key understanding in giving certainty in homeopathy is to have this aphorism by heart. Put this aphorism in your brain and understand this aphorism. Knowledge of disease is very important and vital. Now, this is confusing again because when we are in college, it is said that if you get a case of asthma, forget about the common symptoms of asthma. And with this understanding, what we do is we try to ignore the diagnosis, ignore the understanding of disease. Friends, what Dr. Honeyman has said here in knowledge of disease is to understand the pathophysiology of disease. What is the disease process which is going on? We are not interested in diagnosis, but understanding the disease process will help you give consistent results. So when we talk of now genetic diseases, what is a gene? So understanding or managing genetic disease, let us understand knowledge of disease. What is a gene? So human body is made up of lot of millions and trillions of cells, and each cell there is a nucleus where we have chromosomes. We have 46 chromosomes in our body, X, Y, and autosomal chromosomes. And in each chromosome, then we have genes. So if you broadly understand genetic diseases, then we have problem at these two stages. We have problem at the level of chromosomes, and we have problem at the level of genes. Friends, I'm just trying to make you aware of the knowledge of disease, aware what are genetic diseases. So when we see genetic disease, we have problem at the level of chromosomes and problem at the level of genes. So if you see categories of genetic diseases, then it can be classified into three categories. First is a single gene mutation. This is a very important slide. We all know this, but keep this in mind. So when we categorize diseases, we have diseases which are genetic, which has got mutation in genes, single gene mutation diseases, and chromosomal diseases. So categories of genetic disease can be classified as single gene mutation, and these are few examples of single gene mutation cases where we see dominant and recessive genes. Don't think that this is going to be a very, very deep and a very, very difficult topic. I'm just listing the names of diseases. Knowledge of disease is important. The names of diseases are not important. So we have problem with single gene mutation when a single gene is mutated. And in that categories, we have autosomal genetic problems, and we have sex chromosome, that is X or Y chromosomal problems. Then we have problem at the level of chromosomes. Chromosome में problem है. Now, when you talk of chromosome problem, there can be two types of problem where there is a problem in the number of chromosomes. That is the numerical problems. And a problem can be on the structure of chromosome, where there is a structural problem in the chromosome. So numerical problem, we know Down syndrome, Turner syndrome, Klinefelter syndrome. Structural problem, Prader-Willi syndrome, and XXXYZ, whatever syndrome. Again, I am not a genetic expert, so I'll not be knowing these diseases, but I am going to share the understanding of these diseases. And the third category is a multifactorial multifactorial gene mutation, where multiple genes are involved, and those genes are lying dormant, and whenever there is environmental influences, the diseases express itself, which today we call as diabetes, rheumatoid arthritis, and so on. So genetic diseases can be broadly classified into these three categories, that is single gene mutation problem, chromosomal problem, and multifactorial disease problem. Aphorism number 5, Honeyman says that to cure a disease, to form a portrait of disease, we have to find out what is the exciting cause and what is the fundamental cause in every disease. So let us try to understand the fundamental causes in genetic diseases. So the problem lies with the genes. So mother's history is very important in all genetic cases. Are you with me? Mother's history is very important. But what part of mother's history is important? There lies the trick. That is going to differentiate between your remedies. So what part of mother history is important? And this I call as the timeline of mother's history during pregnancy, where the time is very important, that what time the problem has happened, and during that time the mother's history is important. So what is MHDP? MHDP is mother's history during pregnancy. Now here there are two types of confusion in mind. What do you mean by mother's history? When you talk of mother's history, are you talking of the constitutional or the remedy or the symptoms of the mother, or what are the stress which the mother has gone through the pregnancy? That is the stress during the pregnancy. But we always forget the another key part of the child, baby, the father. So father's history is also very important. So when we have to celebrate Mother's Day, now we are also celebrating Father's Day. which cases father history is important, which cases mother's history is important. That is the most important crux of managing these cases. So the case solving, it's a genetic disease. So stress during pregnancy is very important. That is what's taught to us. But what was the stress during pregnancy? I will just take an example of DMD. DMD is Duchenne muscular dystrophy. It is a genetic disease, a progressive disease, and a rare muscle wasting disease. So when you talk of that it is a genetic disease, it is an X-linked recessive. There is a gradual deterioration of muscle, and this is because of absence of formation of a protein called as dystrophin. Now this dystrophin protein is not forming these children. That is leading to muscle weakness, that leads to muscle destruction replaced by fibrosis, and we have this DMD, Duchenne muscular dystrophy. So when you see, if you see what is genetic, it is an X-linked recessive disease. What does X-linked recessive means? It is the mother is the carrier and the male child is and the affected child. Are you with me? Good. So what part of now mother's history will you take? Yes, any suggestion? Mother's history during pregnancy. What part of mother's history during pregnancy will you take? Yes? Any suggestions? Intrauterine. But problem कहाँ से start हुआ है? Mental state during pregnancy is very important. Yes. But problem कहाँ से शुरू हुआ है? Constitutional medicine. Yes. ये this child is affected. Right? Problem तो लेकिन यहाँ शुरू हुआ है. Stress, pregnancy stress का कोई point ही नहीं इधर. Genetic disease, yes. Mother's family history. So here what Honeyman has said. See, Honeyman had limited resources. That time the technology and science were not so advanced. But he had this great vision where he could understand diseases. So family history is very important. And what family we have to understand. So when you see a case of X-linked recessive like DMD cases, stress during pregnancy is not important. If you take that, you will miss the remedy. But understand the mother's family history mein jao, understand the mother's constitution, take hints from that. So here mother's remedy or mother's characteristic symptoms will form a part of your totality of the child. Are you with me? If the mother is arsenic, don't give the child arsenic. But take the symptoms, key characteristic of mother's constitution, mother's remedy, use that and form a totality of the child where you also consider a part of mother's characteristic symptoms. So DND में हम क्या करेंगे या genetic diseases में हम क्या करेंगे? We'll try to see problem कहाँ पे है and then take that as a part of our totality. I hope I'm making point very clear. See, these are the mistakes which even I used to do. But when I started understanding, my percentage of result has improved. I'm not saying we can cure every disease. See, you're here to improve every day, and every day you should improve. And you will improve only when you understand the disease. I'll just go fast because it's theoretical topic, dystrophin, what it does. So in DMD, if you see the exon number 44 to 53 are affected. Okay. And then there is a genetic mutation. It can be out of range genetic mutation, in frame genetic mutation. Again, disclaimer, I am not a genetic expert. So I am reading these slides and telling you. The moment I come down, don't ask me what is DMD. So knowledge of disease is not important, but knowledge of, as Honeyman has said, the disease is not important, but understanding the pathophysiology is important. So here what you have to understand is where the problem lies. So I will not be knowing the details of this case, what is DMD, but I know DMD में genetic problem है. I would like to know the knowledge, the pathophysiology of the disease process. Okay? So we are not genetic expert, but we would like to understand. So when this case of DMD, this is the report how the patient will present. So whenever you see a case of DMD, the, the, the child will already be gone to an allopathic doctor and they must have done a genetic testing for it. So when we see genetic testing, such kind of reports are given. Deletion seen at which exon level. So in this case, the exon number 49, 50, 51 and 52 were deleted. This is another case of DMD. Now, if you read, baby Neil Ruge presented with slow walking difficulty in changing position and elevated level of CPK. He is suspected to be affected with DMD. He is being evaluated for large deletion duplication. So, pathogenic variation of the suspected phenotype was identified. Another disease where again the exon numbers will be mentioned and what kind of disease. So, these are the few examples of reports which will you get. Reports will already be there in front of you. 80% of our work is done by allopathic doctors. So that is a good part. They will already come with you with a whole bunch of investigation. Now your duty and challenge is to understand what is given in the reports. Again, I'll just keep these slides. It's a psychosyphilitic miasm, signs and symptoms. See this video. This is very important. How the DMD child will present. This is clinical thing. See this video properly. How this is what when you see a child of DMD, you or any child who is complaining of muscle weakness, ask him to sit down and ask him to get up without using any support and see how the child is getting up. This is called as the Gover's sign. So I ask this child to sit down on the ground and get up. This is a typical way the child will get up. So I'll ask the child to sit down and get up.
हात लावू नको खालती.
See the way the child gets up, he cannot just directly lift his body. He will make a triangle, keep his hands on the knees, lift up his trunk and get up. This is called as Gover's sign, which is diagnostic of DMD. The muscle, the dystrophin muscle is destroyed. Because of that, there is weakness. Starts with lower limb. Most used muscles, that is the thigh muscles and the calf muscles, are being used. The child is not able to get up. And if you can see, there is a hypertrophy of the calf muscles also. I just show this in a clip art format so that you can remember. This is clinical, this is practical. We have to see how the child gets up, called as Gover's sign. The child is seated on the floor. They will push their hand on the floor to lift their buttocks, get in prone position, form a triangle, put hands on the knees, and then get up. So every child who complains of weakness, ask simple test. Make him sit down on the floor, ask him to get up. And this will also form your now follow-up criteria. So when you see follow-ups, see how now whether the child is lifting up has improved or not. I just skip this theoretical part. CPK levels are raised because that is the enzyme which is released when the muscles are damaged. Genetic testing is an investigation also which we do. So we'll just see 3 cases of DMD. This is the first case where exon number 49, 50, 51, 52 were deleted. This is the second case. Now this genetic testing is of the mother. When you see the patient present with the family history of DMD in her son 6. So when the child is complaining of DMD, we also try to do the genetic testing of the mother. In this case, there is no pathogenic variant found in the mother. It is a little hazy, so I am just reading it out for you. There is no pathogenic mutation found in the mother, right? This is a third case where again the mother's genetic testing were done. exon number 44 was deleted. So there are 3 cases in front of us. Case number 1, where gene mutations were there from exon number 49 to 52. That was my initial case where we did not do the genetic testing of the mother. So that is why mother genetic testing we have not done. Case number 2, where we saw the genetic mutation, then we saw asked for the mother's genetic testing also. Mother, there is no mutation. Case number 3, the mutation is there in the child and also in the mother. Now, how do we approach these 3 cases? Which history is important? Yes? Case number 1, case number 2, case number 3. Come on, participate. So case number 1 was my initial days of my practice where I was not knowing, so I just gave the remedy or tukka lag gaya. By chance the patient got better. Right? Hit and miss. But then as I understood, now we do genetics. So here, case number 2, what will you take? Come on. बोलो तो समझेगा, नहीं बोलोगे तो नहीं समझेगा. Anyone? Loudly. Pregnancy history will be taken in case number 2? Yes? How many say yes? Raise your hand. How many for no? Rest of all, after a good, nice misal pav, getting into slumber. Come on, wake up. Friends, this is very important for us to understand, understand the disease. Here in case number 2, mother से आया ही नहीं उसमें, तो mother का history लेके करोगे क्या? So not all cases of genetic disease, mother's history is important. अरे mother normal थी, are you with me? So first point is when you see genetic case, do the genetic testing of the mother, check the genetic reports, then ask for the parents' genetic testing also, ask for the mother's reports also. And if mother is negative, that means this is a sporadic mutation in this child. ये इसमें start हुआ है, तो उसमें mother history is little or zero important. Ask the child, ask कि ये कभी से problem है. So the mother says that till 4 years of age he was all okay, his milestones were normal. Then you ask that at 4 years of age what has happened? Exciting cause, aphorism number 5. उसमें mother history is not important because sporadic mutation. And in cases where you see recessive gene in the mother, yes, mother is already presenting there. Mother's history during pregnancy is not important, but the characteristic points in the mother's history will help you to come to the right remedy. Are you with me? This is very important. Understand that the disease shuru kahan se hua hai. Exciting cause, fundamental cause. So understanding aphorism is very important. If you understand and read organon and aphorisms, apply in your practice, this is always going to help you. Not only in your homeopathy practice, but apply, I say that apply organon in your day-to-day life also. Psoric, psychotic, syphilitic miasm हमारे को हर घर में, हर family में, हर situation में मिलेगा. Have a deep understanding of knowledge, your life will change. This was a child.
इथे हर्ष तिकडे इथे चाललं तिथे
कितना टाइम?
ये त्या पाठीचा परत लंगडी करत जा
मागे जा मागे लंगडी करत
कर 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 जा 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 जा.
तसं करून टाकू सर.
So this is a video. I'll just skip the video because
अगदी बस.
this child improved. My point here is not to show that we can cure a case
हात
of
लावू
beauty,
नको
but
वर.
my
असं
point is here to make you understand how you all can do that. So I'll just skip the video because we have limited time. These are the reports CPK how see it was dropping down. ये मेरा तुक्का वाला केस था without understanding. बहुत जुना केस है. I was not knowing what was DMD. But then एक केस अच्छा होता है, 2 केस फेल होता है, तो you go and think why you are not giving consistent result. And then I realized that because I was not understanding the pathophysiology. The CVK level came down. The child is almost 8-9 years of treatment. He's all doing good. So aim of treatment is, in genetic cases, is slow down the progression of disease and improve the quality of life. You cannot reverse genetic diseases, but you can improve the quality of life. So when we see cases of Down syndrome, we see that if we can prolong the duration of life, if we can prolong the life expectancy, if you can make the child more intelligent, if the other symptoms can be managed, these immunity levels and his other gastric problem and other problem associated with child in a Down syndrome, that means we have achieved, as Honeyman has said, aphorism number 1. So aim of disease is to not reverse genetic disease. You cannot reverse, but to improve quality of life and slow down the progression. अभी 8 साल हो गया इस patient को, DMD he is doing good. For me, this is a good result. Let us now understand Down syndrome. So aim of this presentation is to understand the timeline. What is Down syndrome? Down syndrome में क्या होता है? Yes, students. Trisomy. Yes. What is the problem? Extra chromosome, right? कौन सी part of mother's history important है? Mother's history, mother's remedy, mother's symptoms, or mother's history during pregnancy? Yes. I think this part of the audience is responding nicely. So I will now presentation do like this. Yes. Mother's history during pregnancy is important. Yes. Do you all? Mother's symptoms are important. Why? Chromosomal abnormality तो ऊपर से थोड़ी आया है. Who says mother's history during pregnancy is important? Raise your hands. Only 1, 2, 3, 4, 5. Or mother's remedy? 1, 2, 3. Rest. Bouncer. Again, the aim is aphorism number 3. Understand the knowledge of disease. तो क्या है Down syndrome में क्या होता है? So this is a case of a middle class family consisting of father, mother, and 2 children. She already had 2 children, 7-year and 5-year-old. There was a lot of financial stress as the father was the only earning member and his job was not stable. The mother conceived accidentally, and when they came to know about the pregnancy, the mother wanted to abort the child because already 2 child है, financial problem है, तो ये क्यों रखने का? But since this, there was a religious orthodox family, elders in the house advised against the abortion. Since they already had 2 children and their financial status was not good, the mother was not wanting to keep the child. But due to family pressure, they decided to go ahead with the pregnancy, and this pregnancy was then later diagnosed as Down syndrome. How will you solve this case? So what is it's a genetic disease, mother's history during, what is a stress? Yes? Unwanted child. Stress during pregnancy is very important. What was the stress during pregnancy? Not wanting the child, neglected feeling. Remedy? Mag Mure. Any other remedy? Natrum Mure. Yes, very good. So Down syndrome is actually trisomy, extra level of chromosome. There are 3 types of Down syndrome: trisomy, mosaic, translocation. I'm not going to confuse you by going to the types, but we just understand what is trisomy, which is 94% of the time you'll get cases with trisomy. Mosaic and translocation are rare Down syndrome cases. Down syndrome में क्या प्रॉब्लम आता है? एक्स्ट्रा क्रोमोसोम. बट एक्स्ट्रा क्रोमोसोम होता कब है? At what level we see extra chromosome? Mitotic division or meiosis? So during the process of oogenesis, we see and something happens, and then that extra copy of chromosome during the meiosis division, one extra chromosome is get transferred, right? So it is an error occur during the first division of meiosis. Instead of spreading properly, the chromosome fails to divide, leading to one of the resulting cell receive an extra copy of chromosome 21. Meiosis 1. The first stage of meiosis completes in the ovum just prior to ovulation. So now, what is What history is important? Yes? Yes, very good. Good. Here, stress during conception is important. प्रॉब्लम कभी स्टार्ट हुआ? अंडरस्टैंड, एक्साइटिंग कॉज हम लोग कनेक्ट करते हैं ना वो अपने क्लिनिक में. सोरियासिस स्टार्ट हुआ, उसके पहले आपको क्या स्ट्रेस था? सो बिफोर हैव प्रॉब्लम हैपेंड, व्हाट हैपेंड बिफोर? इसमें क्या हुआ? क्रोमोसोम एक्स्ट्रा कॉपी आ गया. कभी स्टार्ट हुआ वो? प्रेगनेंसी में नहीं, प्रेगनेंसी में तो हो गया उसको, fertilization of eggs ho gaya. So mother's history during pregnancy is not important. So here in this case, what you do is you ask the parents, what was your last menstrual cycle date? If the parent says that my last menstrual cycle was on 1st of January, then you ask her from 1st of January to 14th of January, ऐसे life में आपका क्या हुआ? What was the stress? What was the problem during pregnancy? Not during pregnancy, but what was the problem before conception? Are you with me? Making some sense? So here the LMP is important, and the usually this happens between the 16th, and the meiosis happened between the 16th and the 14th day, just prior to ovulation. और फिर उसमें अगर extra copy आ गया तो the child is a Down syndrome copy child, right? So let us now solve this case. We had mother's history, not wanting the child, neglected feeling, that is what we all do, and we give magnesium mute. But this is not going to help. So दोनों नहीं थे, क्या था stress? See, this is genetic treatment, or these diseases are not forte of mine. I can only treat. You all can treat, but हम problem करते हैं कि हम fast करते हैं, no? We just casual ले लेते. Down syndrome कैसे? और अच्छा मिल गया. I did not wanted the child, and we know good remedy, magnesium mure, abandoned feeling, not wanting the child, and we give. But understand, that was not the stress. That was not the right symptom. The right symptom was financial problem. So just little tweaking, little understanding will increase the percentage of your practice. Congenital diseases. चलो अभी आप लोग बताओ क्या करना है? Which part of history is important? Yes. During? Sure. Yes, during pregnancy. This was a googly. Congenital problem में हो गया, and during that time of that organ was developed, that is called as organogenesis. Sperm ovum unite, form zygote, blastocyst, and then 3 germinal layers, and ectoderm, mesoderm, endoderm, embryological understanding. So let us take a case of congenital hypothyroidism. Approach: the thyroid gland is developed during the first trimester of pregnancy, which spans from conception to around 12 weeks. So mother disease during pregnancy is which? First time. Very good. So now we all are genetic experts. Very simple. See, homeopathy is very simple, but provided we understand. So here, if I see a case of congenital hypothyroidism, I will ask if sub chhod do, because the mother is going to give you all stress. नहीं, tell me only during the first 3 trimester, पहले 3 महीने में क्या टेंशन था? Before, after सब भूल जाओ. And when you ask such questions to your patients, that tell me first 3 trimester what, then the patient will also strain their mind and say, yeah, that was the problem, and that is your exciting cause of the disease, and then your results will improve. I'll again skip this because I'll not waste time on showing you the videos. This is what I call as the timeline of pregnancy. My aim of today's presentation was to make you aware of this timeline during pregnancy. So we have problem at the level of single gene mutation, chromosome, that is also called genetic disease, and in congenital anomalies we have this timeline. So this is given, you can, every embryological book will give you this chart. So if this is a case of microcephaly, 8 to 20, you have to ask, say 24, during 2 months to 6 months, what was the stress? If this is a case of bone development problem, you ask dactyly, when the bones are not formed, 8 weeks to 12 weeks, facial development, some problem, disfigurement of face, 6 to 9 weeks. So this is called, I call as a timeline for mother's history for congenital diseases. Let us take one more case. Autism. What is the main cause of autism? Anybody? So autism में क्या होता है? There is a problem in the synapses. The synapses are not functioning properly. When does the synapses form? So when we want to treat a case of autism, there are two types of autism. It's again a very lengthy topic. I'll just cut short. There are two types of autism. One is primary autism and second is secondary autism. Primary autism में होता है when the child exhibits symptoms of autism right from the birth. And in secondary autism, we find children who were quite normal till 18 months of age. After that, something happened and the child starts showing symptoms of autism. That is no eye contact, no response, no command following. So first, when you see a case of autism, find out whether it's a primary autism or secondary autism. If it is a case of primary autism, then you ask mother's history. If it is a case of secondary autism, mother's history again is not important. Are you with me? This small understanding will help you. Knowledge of disease. So in case of autism, if you see the problem is there in the synapses, and when you talk of synapses, the synapses are majorly formed during the second trimester of pregnancy, and then there is a process called as synaptic pruning, which continues in the third trimester of pregnancy. So when I see a case of autism, primary autism, what part of the mother's history will you take? Loudly? Second trimester. So main cause of autism is lack of synaptogenesis and lack of synaptic pruning, failure to stop synaptic pruning. This happened during the second trimester of pregnancy. So in cases of autism, find out which type primary autism. History during the second trimester is important. First trimester में कुछ tension होगा तो that is not the cause of autism. And in secondary autism, mother's history is important. Last, we'll take cases of cerebral palsies. Which part of history is important now? Yes? First trimester. Yes? Again, usually cerebral palsy, when we talk of, it is because of some problem during, I can skip the videos. Huh? Find out the cause. So usually that is a problem during labor. Cerebral palsy में क्या होता है? बच्चा जब डिलीवरी के टाइम पे, if the labor is not proper, if the child does not get proper oxygen, that is a damage to the brain. So in case of cerebral palsy, last trimester history and the history during labor is important. So if you get an history where the child swallowed meconium or there was a cord entangled around the neck, then the history in the last trimester is important. But the whole pregnancy was uneventful and during the labor there was some problem. The child did not, C-section था, child breathe नहीं किया, doctor was not available, troubled labor, they tried to put out, do a forceps delivery, XYZ, then the cause is important. So in case of cerebral palsy, if it is due to meconium aspiration or cord entangle, then the last history is important. If it is during the labor process, some physical trauma, then you see the cause. Take that as a part of your totality. And there are three major causes. HIE, hypoxic ischemic encephalopathy, or there is a periventricular hemorrhage, or there is jaundice. And now when you go back to your repertories, you will find all these rubrics are available. हमारे रेपर्टरी में खजाना है, खाली आपको ये समझना चाहिए कि ढूंढना कैसे है और ढूंढना क्या है. So that time in cases of cerebral palsy, you use this rubric which are for brain injuries like neonatal jaundice, tumor, concussion. Forceps delivery हुआ, there is a concussion, take this rubric. Inflammation, meningitis, hypoxia, hemorrhage. आप बोलोगे how do I understand whether it is a hypoxia or hemorrhage? The MRI report. 80% of the job is done by the allopaths for us, thanks to them. So the child comes to you and brings up an MRI report. In MRI report, if you read properly, it will mention that the brain damage is either because of an ischemia or because of an hemorrhage. Both can cause brain damage. Or it can be because of jaundice, kernicterus. So वो हिस्ट्री आपके पास रेडीमेड लेके आएगा. Only thing is you should be able to read. And my guru was always used to say, your eyes will see if your mind knows. And my main aim of this presentation was to make you aware of how to understand. And now I expect you all to go back to your clinics. If you are in OPDs, try to see what the cause is, try to understand a proper timeline and find out. So if your mind knows, your eyes will see. So if your mind knows that there are types of brain damages, so when the MRI report is in front of you, you can see, because here they will properly mention whether it is because of an ischemia or because of an hemorrhage, right? So summing up what we understood today, this is timeline of pregnancy. What are the cases which we see? Single gene mutation, parents history is important. So if it is because of father, father's history, because of mother, mother's history, like DMD. Okay. Second, we have gene problem. Sorry, chromosomal. This is gene problem. Chromosomal problem. Chromosome problem में क्या होता है? When the chromosomes are either structurally damaged or a numerical problem. There, mother's history before conception is important. In cases of autism, which history is important? Second trimester. Very good. Good morning, everybody. Congenital, see which organ was damaged, go to your embryology books, find out which week that organ is developed, ask the mother's history during that particular specific weeks, and then finally multifactorial. इसमें और एक आएगा CP during the labor. And when you talk of multifactorial, which nowadays we everybody see diabetes, there we ask that what was the exciting factors. Genes are already there from the parents. So you ask कि क्या stress चल रहा था आपका life में, and this is common which we do every day in day out our practice for diabetes, and we find out the exciting cause. Everything is quite properly mentioned in organon. So when we understand aphorism number 3 properly, then it will not be an hit and miss. You'll be knowing. So if you get a proper history, you know, yes, I can help this child. If you don't, then you know, okay, I will not be able to help this child. So this is, we get certainty. So everything is about certainty, and more certain you are with your prescription, more confident you will appear in front of your patients, and more confidently you will be able to say, yes, I can help out this child, and then nobody can stop your success. So with this call as GenoCare, you can do genetic transformation in your patients. I thank you all for giving me a patient hearing. Again, disclaimer, I'm not a genetic expert. So once I come down, don't ask me about anything about genetic diseases. No, I don't know anything. But yes, I know pathophysiology. So now I understand chromosome problem, gene problem, the trimester problem, and then I try to probe. Thank you all for giving me a patient hearing. Thank you.
That's the first time sufficient question from them. You told everything, but you never told the drug what you gave.
So this is very nice question. What was the medicine? So my guru, again, I will quote he said that if I give you fish to eat, you will eat one day. But if I teach you fishing, you will eat fish for whole of your life. I skipped all my videos, results तो आएगा, आपको भी आता है, मेरे से ज्यादा रिजल्ट यहाँ सीनियर बैठे, उनको ज्यादा रिजल्ट होंगे. But here my aim is to make this next generation who are not wanting to practice, they don't want to practice allopathy कर लेते हैं या कुछ कर लेते हैं. नहीं, it's a beautiful science. You should thankful, should be grateful that you have come to this beautiful science, और इसका scope is limitless. Hanuman has given you this beautiful science, and you are fortunate enough to learn this science. इसमें आपके family members का help होगा, आपका खुद का help होगा, because where allopathy stops, homeopathy starts. Thank you very much. Any questions if you have?
Thank you, sir, for this wonderful insights on how to understand genetic diseases and instilling in us the confidence to take up genetic cases. Thank you very much. I now request our co-chairman and chairman to please present the memento to our speaker.
Hello.
Only two questions.
Hello.
Yes.
Can I?
Yes, sir. Sir, difficult question मत पूछना.
No, no. In Duchenne's muscular dystrophy, when you said we can arrest the progress of the disease, is it replacement of muscle mass by adipose tissues was arrested, or the lifespan got
Lifespan got the even the destruction stopped. The lifespan because उसके बाद उसको आगे कुछ और muscle development problem हुआ नहीं. Still he is not able to climb the 2 floors. You know इतना climb नहीं कर पाता है. But he is able to cycle. And this patient is there since 2015. That means almost 8 years, and he's doing good. So muscular, what I've seen that the deterioration is quite fast in DMD cases. So here we are, even if you can arrest the disease and improve the quality of life, that is a good sign.
normally the lifespan doesn't cross
12,
21.
13. Maximum 13, 14
Maximum
years.
13, 14 years. 13,
of
14 years. 13, 14 plus maximum their lifespan is around 19 years old. Muscle mass, when it gets replaced by adipose tissue, it becomes totally bedridden. Was that arrested?
Huh. So this case was that, but not all cases. See, again, I tell you that we'll not get 100% result in all cases. So here the main point was that Pele I was not knowing this. Now, if I know that there is a cause, and if I can key characteristic either in the mother or if the sporadic mutation in the child, then I am confident. Yes, I can be able to help this child. So, मेरा confidence level increase होता है if I know, yes, I know what has happened in this child. There are many times when we don't get the history. There are mother बोलते हैं नहीं कुछ भी नहीं मालूम था. If you take mother's history also, they will know characteristics, or you don't get the cause. There is a limitation. So there you find a lot of difficulties.
On behalf of all of us, I really compliment you because you have broken through a real nut here, which is a very hard nut to crack.
Thank you, sir.
Thank you, sir.
Good morning, sir. Sir, I just wanted to know if we know the exciting cause of that child, whatever has happened in that particular period, when we take a totality of symptom, that exciting cause को पकड़ के बाकी का totality पकड़ के एक remedy आता है वो देंगे. अगर वो exciting cause अगर एक particular remedy में नहीं है और बाकी सब totality मिल रहा है, तो where should we take the decision, sir?
You know about eliminating repertorization?
Yes, sir.
What does that mean?
Means elements from that exciting.
Eliminating repertorization.
Eliminating.
So take that rubric as eliminative. So only consider remedies which are there in that rubric.
Do that rubric, yes, sir.
That is eliminative repertorization will help you most of the time in such cases.
Yes, sir.
Because see, this case can be magnesium also, can be natrum also, or can be any other remedy. But ये natrum है या magnesium है, वो decide करेगा तुम्हारा cause में, and the cause make it as eliminative.
Yes, sir.
So suppose if you take elements from domination by parents, 4 remedies.
4 remedies, sir. Like
in new remedies, you'll get some few more remedies. Yes. Take that as eliminative. Then consider out of those 4 remedies also. Yes, usually sir. That helps.
That helps.
Sometimes if the totality is so strong that वो eliminative point में cover नहीं होता है, तो then you can go with the totality. But again, my guru said, homeopathy is mathematics.
Yes, sir. Mathematics.
तो वो अगर eliminating में cover होना ही चाहिए, होगा ही. Take that as an eliminative rubric and your totality will change. Yes. See, everybody gets result. That fine tuning, अभी हम लोग जब जाते हैं कार में सुनते हैं FM रेडियो, तो 98.3 पे आवाज क्लियर आता है और 98.2 पे आवाज क्लियर नहीं आता है, राइट? सेम वे. सो इफ दिस केस वाज देयर डाउन सिंड्रोम का जो मैंने एग्जांपल दिया, नॉट वांटिंग द चाइल्ड वाज द कॉमन व्हिच वी टू, बट एक्चुअली वो नहीं था. इफ यू जस्ट ट्विक लिटिल, 98.2 पे तुम्हारा गाड़ी चल रहा था, बट इफ यू जस्ट ट्विक इट 98.3 and if you take financial problem, yes, sir, then the results will be there.
Yes, sir. Thank you, sir. Thank you, sir.
Thank you, sir. I request Dr. B.D. Patel, sir, to give the concluding remarks for the session.
Well, friends, there is a saying in Adi Shankaracharya said one word, one Bhajagovindam. Punarapi jananam, punarapi maranam, punarapi janane jathare shayanam. A fetus see, this is a life cycle. You take birth, die, take birth, die. But the best and safest position is when the child is in the mother's womb. And our expert person, Dr. Praveen Jain, has spoken a lot of these things on this. One thing I liked about him is he never wasted time in telling the disease part, because that will take one day session and this is not 45-minute session. And straight away he came to the art of fishing. He has taught you art of fishing. And let me tell you, you see only these cases, no other cases, all cases. See, I have some chelas in all over India. So one person that in Lucknow, Pankaj Srivastav, he will see only orthopedic cases. He will not see any other case. And he has built a big empire. Like that one person in Gujarat, he will see only hair fall. I didn't go to them. Only only hair fall. So why not youngsters? See, you can't make me to take up a specialty. Why not you? Take up one person. You are all family, well-doing people. One person take up one specialty. Let us say we'll take genetic diseases. And you see, once you establish one or two cases, and you will be a king in that field. So let us start specialize. Somebody take up asthma, only asthma. Now in Bangalore, we have one PCOD specialist, homeopathic doctor. He will take only PCOD cases. That means a thorough study. What yesterday they were talking about the research and all that, you can present that. So this is a new chance and a new field and a wonderful presentation by Dr. Praveen Jain. He needs an applaud. He didn't mince words, didn't waste time, didn't bore you, didn't bore us also. Okay. Well, thank you, friends.
Thank you, sir. As we move towards the next session, I invite our resource person, Dr. Anup Negvekar, sir, onto the stage. Welcome, sir. I request Dr. Swarupa Patil, ma'am, to introduce our guest speaker, Dr. Anup Negvekar, sir.
Thank you. It is an immense pleasure to introduce the next speaker, Dr. Anup Negvekar, practicing homeopathic physician for more than 30 years. He is a professor in HOD Department of Repertory in Dr. M.L. Dhawale Memorial Homeopathic Institute since 2002. He has served as a consultant and head of Department of Dermatology and also the Department of Geriatrics in Dr. M.L. Dhawale's Memorial Trust Rural Homeopathic Hospital, Palghar. He is a recognized PhD guide and examiner at Maharashtra University of Medical Sciences, Nasik since 2020. He is also faculty for basic and advanced teaching and research methodology at Maharashtra University of, Health Sciences, Nasik. He has published more than 20 papers in peer-reviewed journals and conference proceedings. He is a member of CCRH committee for creating NABH homeopathic standards from July 2016. Is a member of NABH Ayush Accreditation and Technical Committees, faculty NABH Ayush Assessor Training, and Principal Assessor NABH Ayush. His administrative role is as a member of the governing body, National Institute of Homeopathy, Kolkata. And he is also a member, expert committee, IRDA Homeopathy, Central Council of Research in Homeopathy, New Delhi. He has served as an honorary secretary of Dr. M.L. Dhawale Memorial Trust and director of Dr. M.L. Dhawale Memorial Homeopathic Institute. With this, I present and welcome Dr. Anup Negvekar, sir. Thank you.
Thank you, ma'am. I now request Dr. Rinku Porwal to present a floral welcome to Dr. Anup Negvekar, sir.
Hello? Audible? Yeah. Sorry. Sometimes accidents in life are welcome, as one happened today morning. I was to speak first, Dr. Praveen speaks second. He spoke first, I speak second. It's a welcome accident for me because, he covered a ground which I thought I should be covering, and I will take over from that ground, maybe a little ahead. And I thank Dr. Prakash for making a statement of choosing careers of one specialty in your life and build upon it. I mean, a whole presentation that I want to share today stands on these two thoughts that came up. This presentation of mine, I am working in this field of geriatrics and homeopathy since 2014. It's a very pleasurable initiative for me because as I become aged, I want to learn more about aging. And that is an incentive for me to start. And I thought that should be an incentive for you all to begin your life as well. Because when I initiated my practice in homeopathy, I was told that if you treat a child in homeopathy, you have made your life. Because one child will bring a family and the family will sustain your stomach. But as I see now, for the next generation, if you treat an old man, you will get a family. Because managing an old man is a tough challenge for families. Prakash sir? We are all getting old, and it is becoming more and more difficult for our families to manage us as well. So friends, we are here to share with you some experiences that have brought in some thoughts in our mind as to what it is that we should know so that we make some good positive change in the life of so many who are desirous for getting help from us. The first photograph that we see, is a inmate with us. The whole wall that we have created is plastered with such images across the walls. People believe that old age is a Gaya Gujra thing. There has to be a cheerfulness and happiness and a feeling of being wanted and desired to be listened to. And that is a mahol that needs to be established. Yesterday evening, I visited to one of my friend's house and I saw his aging mother. She was 85, bedridden, lying in a room, attended by two attenders. The family is not oriented to how to take care of that old lady. And I have seen that kaku of mine when I was 15 years old, and today I am 58. So 43 years kind of I've seen that lady go from what to what. And it is something that I believe that we all should try, because I'm sure many of you may be having grandparents. How many of you have grandparents living with you? Please raise your hand. Oh yeah, that's a fantastic number. And I'm sure your parents love you significantly, because in Marathi there is always a saying ki dudapeksha dudacha saivar prem jast asta. So I'm sure you may be experiencing that bliss of your life. And we desire to move to bringing it across to a larger people. It's a very simple thing. Loss of teeth. Forget the loss of hair, which I heard yesterday talks of intelligence and gained knowledge. But loss of teeth does talk of so many things in life. Most of us, basically for an old man, these three things become very, very crucial. A lost teeth, you are getting into a track of getting inadequate nutrition for yourself. A lost teeth, you are not going to take care of your basic oral hygiene, because there is no teeth, you don't have a toothbrush. You don't have a toothbrush, you don't wash your mouth. You don't wash your mouth, you invite oral infections. A silly system for this is to ensure that you keep your mouth wet as frequently as possible in an aged person with few teeth in his mouth. That's all that is essential. But we tend to not to, because we believe जितना पानी पिएगा उतना पेशाब करेगा. वो पेशाब करेगा, ओल्ड मैन उठेगा कि नहीं उठाएगा, तो उठाएगा कौन, उठाएगा तो गिराएगा क्या, गिराएगा तो हड्डी तोड़ेगा क्या, हड्डी तोड़ेगा तो साला और प्रॉब्लम. इसलिए पानी मत पिलाओ. पानी नहीं पिलाओगे तो you have inviting situation. So that's one fact of life. So please ensure you drink adequate amount of water now onwards till you lie in the final step of your life. So please do that. Speech impaired. I don't know how many of you listen to your grandparents talk, and you may find it very difficult to understand what is it that they are saying, and they are saying with their whole heart what they desire to convey to you. There's a simple method that we should try and adopt. I'll just share with you these videos. I request there are multiple slides in this presentation, and all of you are free to click to your glory and the memory capacity of your mobiles, whichever slide you want to click to. I have no objections on these matters. But when it comes to videos of the patient that I'm just sharing, please use your appropriate senses to ensure we are not replicating the identities. Audio? आणि पायाचा ठीक आहे. हाताला कुठे दुखतं का? हातामध्ये हातामध्ये नाही.
पायाचे पंजे तळपाय
हा हा
ते आग होते.
आग होते. ठीक आहे. आता जेवण मध्ये काय जेवलीस?
कढी भात
हा
खिचडी
खिचडी होती.
चपाती
आणि सकाळी नाश्त्याला काय होतं? You know, what is she trying to convey? The physician is trying to reconfirm. You know, there are so many words that she is sharing which attempt to convey to you that this is what she is saying. तो डाळ भात त्यांची शेत नाही खिचडी खाल्ली. मग त्या बाईनं डाळ भात खाल्ली का खिचडी खाल्ली? She is trying to convey to you something that she has consumed some things in life at that day in the morning. So you have to try and listen carefully. No teeth, no chewing, no chewing, limited elements can be consumed. Nutrition gets compromised. Simple. Salivary gland functioning reduces, therefore the moisture of the mouth reduces, therefore the infection rate goes on increasing. Tongue and teeth help us to speak. If teeth are missing, words are not properly pronounced. So it is very important that we ensure a good oral hygiene from a very young age till as you grow old. This is something that we should be really cherishing with yourself. Take care of yourself. Second case, a 75-year-old lady was admitted in our ward. You know, one fine day in the middle of the night, she tries to get out of the bed. She trips and falls down. She falls down and breaks the thigh bone. A situation, you never invited the patient to lie in your ward for a reason for which she was now experiencing pain and agony. Trigger for thinking. You know, thinking becomes a very crucial factor. Why did she fall? You know, can this be prevented? What knowledge is, as physicians, we should have to ensure we look at these small potential sentinel events which can be disastrous. You know, please take this case as a case that you should be very careful with your grandparents, within your houses, every day. There's a potential hazard that is in waiting for a simple reason that something was not taken care of. In her case, you know, when we tried to understand what happened, you know, she had an idea की सकाळ झालेली आहे आणि आता मला उठलं पाहिजे. ती उठायला गेली तेव्हा बाकीच्या लोकांना तर रात्र होती. त्या रात्रीच्या झोपेत ती अर्धवट झोपेत उठते, वळायला जाते. शी इज अनेबल टू कंट्रोल हर मूवमेंट. शी इज वेअरिंग अन हॉस्पिटल गाऊन. Her feet get caught in the gown and she doesn't land on the floor. She drops on the floor. Very simple, isn't it? Even cause. Dr. Praveen was asking us to identify the cause. So trace the cause. So why? In management, there is a concept. You have to go back tracing whys. So ask anything 7 times why and you'll find a solution. So ask 7 whys in your life to get to the logic behind the cause of the situation. And this is something that you will nearly have to face if you are not careful. Second case, a bedridden hemiplegic. Very interesting problem. A lady is lying in the bed in the ward with us. Now, this ward that I'm just mentioning time and again, there's a story behind it. We initiated this process of attending to geriatrics since 2014, when we were invited to attend to a Vruddhashram, where there were 14 inmates at that time, and they were asking us to try and take care of them. We started going there. Then we realized that just going there doesn't make sense. We have to start informing people through our homeopathic OPD that we run in our institution, that there is a potential for aged people to try and get relief from homeopathy. And as we started proceeding ahead, we identified that there are people in this world who cannot come to your OPDs. We made an elaborate study of a 10-year database of people who come to our hospital. I scanned through all the patients 60 years and above. We identified there were 2,500 people who came starting 60 years to range 103. In that process, we identified beyond 65 years of age, it's very difficult for people to come to your hospitals independently. 65 to 70 years of age, people come with an assistance. Beyond 70, it is very difficult because the patient is dependent on the caregiver. So it depends कि बेटे को टाइम है क्या, बेटी को टाइम है क्या, बहू को टाइम है क्या, तो वो ओल्ड मैन को दवाई के लिए लेके जाएंगे. And that becomes a change in the switch in the priority. Consequentially, because of that, there is a problem. New families are becoming smaller, from joint families becoming nuclear families is also a learning that we had. The lesson of the nuclear family is that there are less people to take care. I don't know, people who have experienced large joint families, someone brought up the child in the house. It was not necessarily the parents who brought the child up. तो किसी ना किसी की दुआ से बच्चा बड़ा हो गया. अब ये बूढ़ा जो घर में बैठा है, उसको केयर करने के लिए घर में लोग ही कम है. तो लोग कम है तो दोष किसका? किसी का भी नहीं. ये नियति का दोष है, बोलना है तो बोल दो, मगर ये सिचुएशन हो गई खड़ी घर में. तो ऐसे लोगों को हमने क्राइटेरिया रखा कि ऑल दोज पीपल हु आर डिपेंडेंट, those category of people are only welcome to our hospital setup, and those people we admit, because these are the people who can't be taken care of at home, even though the family desires to take care of them. So we try to help them out, and then they go back to their homes. This was one such case. So when this lady comes with hemiplegia and lies in the bed with us, we are trying to do a lot of therapies with her. Physiotherapy is on, homeopathy is on, the family is being counseled in terms of all, speech therapy is on. And in the process of all this, the lady comes up shouting at people. And when she starts shouting, I start tracing back की बाबा काय ओरडते कशाला तू बाई, तुला काय झालं, कशामुळे तुला त्रास झाला. She just goes on saying की ह्या माणसानं मला त्रास दिला. She makes a specific mention कि ये आदमी ने मेरे को तकलीफ दी है. तो वो आदमी ने तकलीफ दी, मतलब तकलीफ दी, मैंने हमारे दिमाग में एक ही आता है ना यार, किसी औरत को जाके किसी ने गड़बड़ तो किया नहीं है. Whether there has been a misbehavior or a misdeed, that is where we started checking, and then we realized no, that is not the case. You may have experienced old people who are lying in the bed are typically attended in this particular manner. They're pulled up through their shoulders and they are pushed up to their beds. Families sometimes try to bring in semi-fowlers or fowlers, and they rotate the bed end from the side end, so head top hota hai, head down hota hai, leg up hota hai. People try and figure out some things. But typically people are moved like this. There is a consequence of this. If we are not careful in doing this work in a very caring way, you are depending on the mood of the caregiver. That is what we have identified. जो पेशेंट को संभालने वाला है, उसका वो मोमेंट का मूड कैसा है, खुशी में है कि गुस्से में है, उसको टाइम प्रेशर आया गया है कि वो शांति से काम कर रहा है, उसका प्रेशर उस प्रेशर पे चढ़ जाता है जो दोनों हाथों में दिखता है. And then the patient is yanked off, and that is where the problem begins. So whenever you are trying to change, move, lift old people in your house, please be caring and careful. Don't use your strength. Ensure what is the strength existing in that old man's body, and try to sync these two strengths. What happens? I'll explain to you in the few slides later. This problem occurred. The lady's musculature was bruised because someone just yanked it off, and the lady was unable to move her arms because there was a huge bruise that occurred, and that silly thing became a problem for us. Now, why this silly becomes a problem, I will just share with you again in the next cases. What could have happened? Diarrhea. Diarrhea in an old man. It's very interesting. कॉन्स्टिपेशन प्रॉब्लम है कि डायरिया प्रॉब्लम है जिंदगी में? कितने लोगों को लगता है कॉन्स्टिपेशन प्रॉब्लम है जिंदगी का, और कितने लोगों को लगता है डायरिया प्रॉब्लम है जिंदगी का? पेट साफ तो दिन खुश, पेट पे वांदा तो दिन की गई काम से. So people ensure they have a great relieved abdomen intestine and evacuated themselves well, so they are in an excited mood through the day. One old man, 91-year-old, complains कि उसने 3 दिन मोशन नहीं किया है. होम्योपैथिक दवाई दी जाती है, होम्योपैथिक दवाई का असर नहीं होता है, 5 दिन हो जाता है. वो बूढ़ो बैठे बैठे इतना पकड़े, he is become psyched off कि सर I have not passed motions. I mean he has nothing to do in his life. He is sitting in the bed or sitting in the chair or walking and reading newspapers and television, but still that motion not occurring is a big situation for this man. He insists कि साला कुछ तो करो और मेरा पेट साफ कराओ. So किसी को दया आती है, उसको एक छोटे से माइल्ड लैक्सेटिव का छोटा सा गोली वो ओल्ड मैन को दिया जाता है. वो बूढ़ों का तो प्रेशर ढीला, वो आदमी साफ, परेशानी पड़ गई. The man landed into diarrhea and it became an uncontrolled diarrheal situation. And in this diarrheal situation, what happens? The man starts losing his mind. He becomes so irritated and excited. The people who are caregiving, they don't understand इसका diarrhea को check करे कि इसके anger को check करे. Now why does this situation occur? It is so silly. And the silliness begins for a simple reason कि we don't know what is the concept of constipation. कैसा भी करके पेट साफ करो, पर पेट साफ करना मतलब कॉन्स्टिपेशन का जवानी में डेफिनेशन क्या और बुढ़ापे में डेफिनेशन क्या, भाई साहब अलग अलग है. Please, again what Dr. Praveen was saying, orientation of our knowledge is, it is important. If an old man doesn't pass stool for X number of days, whether it is a problem, yes, it is a psychological problem. There is an evacuation problem. Yes, there is a potential evacuation problem, but there is a serious problem because since he doesn't have teeth in his mouth, he is not eating anything. So he's not going to eat anything, he's not going to create anything. Abhi, this logic is oriented with the physicians that we have here. Now, having known that, if you create a diarrheal kind of situation in an old man, then you have had it. Please take it from me. A constipation is better than a diarrhea in an old man because he tends to lose huge amount of electrolytes, and a loss of electrolyte imbalance becomes a serious challenge because you can't infuse electrolytes like you would have done it in a youngster. I will show you why I'm saying this statement. Now that becomes a challenge. You can't go on feeding him electrolytes because again he will start urinating. Again there is a problem. If you are going to feed him electrolytes, उसका hypertension बढ़ जाएगा. आपको समझेगा ही नहीं आप क्या कर रहे हो, और प्रॉब्लम के ऊपर प्रॉब्लम इनटू n नंबर ऑफ टाइम्स बढ़ते जाएगा, ऑल इन द होप कि साला इसका डायरिया कॉन्स्टिपेशन ढीला कर दो. डायरिया पैदा हो गया, you are in serious trouble. So please look at diarrhea as a more serious problem in an old man. Now why that becomes a problem will come to it. Measuring BP, another interesting, common hai. It's a very common thing. I sure you may have learnt it in physiology practicals. How to measure a blood pressure in a sphygmomanometer. You are taught how to do it. We are taught how to do it. But friends, over a period of time, as you start becoming clinicians of repute and haste with a large waiting crowd outside your OPDs, you forget what your department of physiology taught you in your first BHMS. And unfortunately, it created a situation. One such situation got created at our end also. Suddenly, uske left mid arm में bruise आया इतना बड़ा. क्यों आया बाबा? ऐसा क्या ओल्ड मैन कुश्ती लड़ने गया कि यहाँ पे सारा लेफ्ट मिड आर्म में जाके इतना बड़ा ब्रूज होना चाहिए? तब ध्यान में आया कि बीपी कैसे लेना. जो डॉक्टर साहब ने बीपी ली थी लास्ट, उसको मालूम नहीं था. आप देखना, check whether you have this practice. Normally we put a cuff on the patient's arm and you just start pumping, direct stethoscope लगाते उसको radial artery किधर, हाँ, and you start checking कि बाबा इसका pulsation direct इधर चालू कर देते हैं, and you just pumping from one hand, the stethoscope is on the other part over here, and you are checking what is the pressure up and down. तो तुमको ठक ठक हुआ, ठक गया, तुमने रिकॉर्ड लिया. भाई साहब ऐसे कभी नहीं करना. 60 साल के बूढ़े के हाथ में अगर आपने बीपी का कफ चढ़ा दिया है तो शांति से पहला उसका पल्स देखो, और पल्स देखते देखते उसका प्रेशर बढ़ाओ. आपको सेंसेशन, आपका सेंसेशन रुक जाता है. फिजियोलॉजी में बोला गया था 10 ऊपर जाओ, प्लीज 10 ऊपर मत जाना, जहां रुका वहीं रुक जाओ. फिर आपका स्टेथोस्कोप का इस्तेमाल करके उसका बीपी ले लो. पॉसिबल, doable, it should be doable. There is no option, because if you land with an injury to an old man, you know you had an irritated old man in your house. So please be careful. Now, triggers of thinking. What did I miss? Please understand this. You know, as I said for the diarrhea, I am saying it for this also. आप लोगों ने इन्फेंट्स का स्किन देखा है? कितने लोगों ने इन्फेंट्स को देखा है? देखा है, सब लोगों ने देखा है. आपको इन्फेंट की स्किन को हाथ लगाना कितना अच्छा लगता है? मुलायम, सॉफ्ट, जितना चाहिए वो बेबी को हक करो. कितना लोग बूढ़े को हक करने जाते हो? शायद उसकी चमड़ी में कुछ रहता ही नहीं है जो बच्चे के अंदर रहता है. द मुलायमपना, softness, that fluffiness and the cuteness. You know, the old man's skin is like this. वो स्किन में कुछ है ही नहीं, पूरा झुरिया है. सपोज ऐसे पेशेंट को अगर डायरिया होता है तो इसका वेन कहाँ ढूंढोगे आप? वो वेंसो डालने के चक्कर में वो कितना प्रिक होता है ना. वो ओल्ड मैन को जब प्रिक होगा और जो ओल्ड मैन चिल्लाने चालू करेगा तब आपको बताएगा कि क्या होता है. ग्रेस ऑफ गॉड, विश that in your life at the age of 70 plus you don't land up in a state where you need to be an IV infused patient, because that's a time when you'll be in serious pains, because जो करने वाला रहता है ना वो अपने जैसा ही रहता है, घाई घाई में लोड करता है अपने को और उसको वेन मिलती नहीं है. The second problem is the second image that I've shown there. Please understand, जितना उम्र बढ़ता है उतना फ्रेलिटी बढ़ती है. कोई भी पुराना किताब ढूंढो आपके घर में, आपके बाप दादा ने जो रखा होगा किताब, वो किताब को आप जरूर देखना, उसका कलर पीला हो गया होगा. वो बुक ऐसी की ऐसी रही होगी, उसको खोलने जाओगे तो सडनली वो बुक खुल जाती है पूरा, क्योंकि उसका गमिंग वमिंग सब निकल गया है. उसका जो अंदर का पन्ना रहता है उसको निकालने जाओगे, ऐसा ऐसा करने जाओगे तो पन्ना हाथ में आएगा टूट के आपके. उसको शांति से एक एक पन्ना हटाना पड़ता है, तब जाके अगला पेज देख सकते हो. That's exactly what happens in an old man. The old man's anatomy starts becoming frail. The anatomy that you and I read in Gray, you and I read physiology in Guyton, the old man's anatomy and physiology is much, much different. The intestinal motility goes down, therefore the sense of constipation increases, and in the state of treating the constipation you create a diarrhea that we created in one case. We pump in more pressure in the cuff of the BP, you end up bruising the arm just because the frailty index was not known to us as to what happens to the basic anatomical structure under that skin. Please try and be oriented to this. Please ensure that skills that you have learned, you carry them with you. Don't forget them midway in your life. And that is something we should seriously look at and be oriented about. You know why we should be so careful? You know, as I stated in my opening, once upon a time, बच्चे को ट्रीट करो पैसा कमाओगे, अभी बूढ़े को ट्रीट करोगे बहुत सारा पैसा कमाओगे, बिकॉज बूढ़े लोग के पास बहुत पैसा रहता है. जवान छोकरे मर मर रहे हैं पैसा कमा रहे. अरे आपके घर आऊंगा तो समझेगा मेरे को, कहाँ रखा है वो देखेंगे तो ध्यान में आएगा कितना है आपके पास. वो बूढ़ो बहुत सिक्रेटिव रहते हैं, पैसा कहाँ रखे ना उनके मरने के बाद समझता है कि साला यहाँ यहाँ रख के मरा. वो जिंदा था तभी बच्चे को नहीं बताया. Rest assured, seniors are going to be large in population. large in population. There's a pakka skewed demographic change that is going to occur. And as a result of this, we have to become oriented to these ideas. India being a rural country with a large rural population, I'm sure many of you may be staying nearby or desiring to practice in a taluk, sub taluk, or maybe a village, which is a very, very good thought that you all have or should have, if you ask me, because I serve people right from the tribal zones to the posh setups in Mumbai. So the whole range is demanding. And this demand is something that brings us to a very basic thought. Treating an old man as a very simple thing. Dr. Praveen mentioned of aphorism 3. I am mentioning aphorism 1 as well now. High and only mission, is restore the sick to health. Health is essential. Cure may not. You are ensuring a good quality of life in a child that you saw. A same situation exists for a good quality of life in an old man. So therefore I said accidents are good in life. So you heard a child first, now you hear an old man now. So we kept the whole range in the horizon. So the health is an important phenomena that is there. For me, he was the man whose learnings I carried through my 30 years of my clinical practice. I never met this gentleman ever in my life, but all that I read that he wrote and left has something that has helped me to structuralize all that I've been able to do in my life since I left AM Sheikh in 87. So I carry the legacy that Urchankar sir taught me because he was my Matra Medica teacher. And since then, this journey is on. One important fact that we all should try and listen, and I'm sure when Dr. Janardhan Nair was sharing yesterday about creating a clinical record that records in an appropriate place, in an appropriate heading. You just heard that I am working in an NABH organization. That is something that we look forward to is standardization of record keeping. What should be the standard of record keeping? The hospital can choose. But once it chooses, it has to abide by it. That's a very simple thought behind that process. So standardization is something that is the only thing that will help you to measure. That was the second component that Dr. Janardhan was saying yesterday. What you measure is something that will enable you to improve. That's what Dr. Praveen was also saying. कि तुम्हारा आज 20% का प्रैक्टिस है इंप्रूवमेंट का, तो उसको 40 बनाना है, तो तुमको ढंग से दिमाग लगा के बैठना पड़ेगा. अगर आपने इनके जैसा दिमाग नहीं लगाया होता, तो जो मिरेक्युलस रिजल्ट्स आप जस्ट देख चुके हो आधे घंटे पहले, वो आपको दिख नहीं सकते हैं. So try and ensure this. This is my place where I come from. We do see a lot of people. We have established an integrated healthcare system which we are operating since now. We have entered the 25th year of the institution. So for last 25 years, we are having integrated practice where we have allopaths with us, homeopaths with us, therapists with us, speech, occupational physiotherapists, neurophysiotherapists, everyone under the sun, we bring and place them in our institution. Because that's how we try to bring about change in the whole world that's changing every day. What was there yesterday is not going to be there tomorrow. We created this ward that we just shared. I just shared with you. This ward is fully operational. We are attending to only those patients who are unable to take care of themselves. Our students are oriented to be sensitive to the care of these people. ये आसमान से नहीं ज्ञान पड़ता है, इसको घिस घिस के ही लाना पड़ता है. सबके दिल में एम्पैथी है, सबके दिल में पेशेंट की तरफ कंसर्न रहता है, उसको इम्प्लीमेंट करना चाहिए. That implementation, what you're seeing here, these kids who are there with us, whom we train, they kind of become the grandchildren, the child, the daughter, granddaughter, the daughter-in-law, that all these old people desired in their life, but they never got actually experience. And our kids also go and fulfill that role for that moment. The doctor suddenly doesn't start going to the house of that fellow. but that feeling state gets created and that care starts getting improved, and that is a significant factor in the health of the old man. So improvement in the quality of a life of an old man strongly depends on the quality of care that he is given. Therefore I said, it's a very classical triangle of an old man. There's a mind, there's a body, and there's a soul. ओल्ड मैन के साथ कभी गप्पे मारना तो आपको ऐसे लगेगा कि ये ओल्ड मैन कहाँ कहाँ की बातें कर रहा है. Yesterday I was talking with my mama. My mama was telling me stories of my grandfather's mentor. Maybe more than 100. My mama today is 88. So he was talking something 50 plus years ago as to where my grandfather and what my grandfather, who supported my grandfather to go wherever he went in the world. Eventually he went in that time to Ann Arbor University, Michigan, became an MD path at that time. And the man in Kakti, believe me what I'm telling you, yesterday night's information, I was so shocked. An old man who was a patil in Kakti saw these grandfathers of mine and tried to mobilize him. And then he goes off, and that mama of mine today recollects की काय माणसं होती रे त्यावेळेला, की कुणाचं काही नाही, पण कोण कुणाला कुठं घेऊन गेला. That is the soul part of an old man. Every old man has a story in his life. Please try to reach to it. There's a body which obviously is frail, which we have to treat. The mind we have to treat. The soul is something we have to touch. We are lucky we stand on these three pillars. Please read Organon. Don't forget it. As homeopaths, most of the time that goes somewhere down the dusty lane, and we don't read that small book. Yep. We have repertory and we have materia medica also. Now, how do we make use of all of this? These are defined aphorisms that are captured. Please read them for sure. They will give you a glimpse on what it takes for you to reach to an old man. Repertories. Please go and check these repertories. When we parked old age as a rubric to be hunted and we choose this, don't go to Kent and see vision. It's not existing there. Don't go to Boric. Go to Kent, you'll see vision. You go to Boric, you'll see ear. You go to synthesis, you see eye. For an old man as a rubric. It's a very important, interesting experience that we had. We never thought it was there. So you don't choose this in that repertory. Interestingly, we identified the set of remedies that came up. We repertorized गधा मुजरी बहुत किया, सब ओल्ड रूब्रिक्स ढूंढ के निकाले, उसको रेपर्टराइज किया, उसमें से टॉप 10 रेमेडीज कौन से, तो ये टॉप 10 रेमेडीज आई. उसको हमने देखा कि तीनों जगह पे कौन सी रेमेडी, 2 जगह पे कौन सी रेमेडी और एक जगह पे कौन सी रेमेडी, ये भी है. इसको आप क्लिक शॉट कर लो, आराम से बैठ के पढ़ो, कोई टेंशन नहीं मेरे को. ये इधर तक तो मैंने काम किया, इसके आगे आप जरूर करना बैठ के. You look at the concept of sphere of action. And from sphere of action, you can go to the clinical condition that you in. So what remedy, what sphere of action, which clinical conditions you can manage. You go to clinical repertories that exist today, you get a fragmented version. Since we're teacher of repertory, I can definitely say that having studied most all the repertories that exist today. There is no linkage between a sphere of action to the clinical condition. You do get some materia medicas which talk of these things. There are no repertories. You will get a repertory which is structured in a different way. You will get a repertory with a chapter of clinical conditions. You will see a whole lot of clinical conditions, and you will see a corresponding remedies to those clinical conditions. But try and look at these things. This is something. When I checked with my clinical experience in the 2,500 patient that we just shared with you, we try to understand the various systems and which are the remedies we actually saw in our actual practice. The previous slides I showed was a literature review study. This is my actual study of remedies that got implemented in these various clinic systems. The markings that are dependent on if I've seen that remedy in 5 cases, I've parked it 3. 3, I've parked 2, less than 2, I've parked 1. So that's how I have numerically classified them. You can click short for it. Take home lessons. This is my last slide for the day. Listen to your elderly patients with empathy. Very simple. You can listen to your friend who is in distress. You should try and learn to listen to an old man who is already in trouble of his life. Demonstrate patience. Very important. Never be in a hurry to engage with an old man. Demonstrate care and concern for the elderly. There is an opportunity to use your knowledge from first BHMS onwards, but with a slight twist. There's a slight twist. Understand the impact of biology on the man and deal with that. So you have to remember what Gray's Anatomy told, you have to remember what Guyton told, but you have to also remember that there's a biology that has moved in life along with the patient and his age, and it has impacted him. So please be oriented. I just demonstrated 5 caselets in which that change you can actually capture home. Apply your knowledges of organon, materia medica and repertory, which I just tried to demonstrate. And remember, we too will also get old. जवानी रहने वाली नहीं है, बुढ़ापा आने ही वाला है. तो आज अभी से उस बुढ़ापे का हैप्पीली इंतजार करो, क्योंकि तब जाके भगवत गीता नहीं पढ़ना या रिलीजियस लिटरेचर नहीं पढ़ना कि मैंने जिंदगी कैसे बनानी चाहिए. भैया आज बनाओ, तब उस दिन पे जाके शांति से तुम रहोगे और तुम्हारा खानदान, तुम्हारा फ्रेंड्स, तुम्हारा रिलेटिव्स तुम्हारे साथ रहेगा. देयरफॉर hence sow love and care and reap health, wealth and peace. Thank you so much for all your patient listening. Thank you so much.
Thank you, sir, for such an informative session about how we have to manage the geriatric cases. I now request Dr. B.D. Patel, sir, to give the concluding remarks for this wonderful session.
Thank you, Dr. Anupji. So now, after hearing to both the sessions, now I remember, I'm trying to understand. I was thinking why I was given this session. Why not yesterday's session? So Dr. Udchankar ji said, "Badi Sara, tum abhi bachcha nahi hai, abhi buddha ho gaya hai." So both the sessions you handle. One is pediatric, another is geriatric. Huh? So भैया अभी मैं 75 का हो रहा हूँ, अभी बूढ़ा नहीं हूँ. तेरा बाप बूढ़ा होगा, मैं बूढ़ा नहीं. There is this, again saying in, see, people have not taken Vedic literature. They have Vedas means immediately you think something religion. Let me tell you one word. There is no God in Vedas if you can really interpret properly. Everything is science. There is a saying, Sharire jarjari bhute vyadhigraste kalebare aushadhi jahanitoyam vaidyo narayano harihi. It means body, sharir, jarjari bhute is going to dissolve in itself. It's going to dismantle. Sharir means, the word sharir means itself that which is going to disintegrate. Many people don't know this. Everything, Sanskrit, very godly language. No language, your language, my language. Only you need to understand each word. Sharir word means that which disintegrates. So Sharira jarjari bhute, as the age grows, it comes down. Vyadhigraste kalevare. At that time, lot of problems come up. Even the problems you may have now, but that will be shown more in your old age. At that time, aushadhi jahannitoyam means whatever doctors you are all giving medicines, that will be like Ganga Jal. Vaidyo Narayano Harihi means Vaidya, doctor, is just like God. That was in Vedic time. But now it is different. You know it. Vaidya Raja Namostubhyam. Yamaraja Sahodara. That means, Dr. Saab, Namaskar. Aapko to namaskar, aap duri raho. Yamaraja Sahodara means the man who is going to take me back from this world is my brother. Yama Harati Pranani means Yama will take only body. Tvam Udchankar Harati Harati Pranani Dhanani cha. Daddy, you take away life and also the money. That's what today's medical profession is. Okay, friends, don't you think you had a wonderful session? Not, I don't want to say any, you are enjoying it now, so don't go away immediately, come back and stay. You will have such wonderful things today. And I thank our Anupji, Dr. Anupji, giving a wonderful tips how to maintain, how to take care of old people. See, drugs, medicines, you can see, and he has given wonderful charts. It will be, I think it will be available on the Facebook, sir. You send us the link. I am also becoming old now. I have to take care of myself. And he's purposely saying, "Tum buddha hai." Okay. So wonderful session we had. We had nice time. Thank you, Dr. Anupji, for a wonderful session. And Praveen, I was forgetting one point. See, many times whenever we present, whenever I talk, I insist more on third aphorism. Knowledge of disease, knowledge of medicine, and knowledge how to apply each. This aphorism hardly anybody has understood or they will understand. Very few people understand this aphorism properly, and if you understand properly, then you'll be able to. I asked many times questions in the examination and all that. What is meant by knowledge of disease? Knowledge of disease means, so for example, sir, there is malaria, you should know the complete symptomatology. Hahnemann never meant that. Am I right? Hahnemann meant what is the thing that you need to cure in the patient. Of course, the disease diagnosis is malaria, but there's something much beyond that which you need to elicit, and those things you need to tackle. Am I right? Somewhere I can be wrong also. My Buddha, he has proved me. Tum buddha ho gaya sir. Okay. I have I have not kept any money in the bank. Kahan rakha mujhe nahi malum hai. Friends, again, read it. Students need not read, I don't mind. But the doctors who are practicing should read. And I remember wonderful quotes from my chela, or my not directly not student, but he's my bhakta, Dr. Vanahali. He says, break the rules, live the life like king. Break homeopathy, practice homeopathy. Okay, thank you.
Thank you, sir. I request our chairman, Dr. B.D. Patel, sir, and our co-chairman, Dr. Swarupa Patil, ma'am, to present a memento to Dr. Anup Nigwekar, sir. Thank you. I request Dr. Anup Nigwekar, sir, and Dr. Praveen Jain, sir, to present a memento to Dr. B.D. Patel, sir, and Dr. Swarupa Patil, ma'am.
Thank you, sir. Thank you, ma'am. We now move ahead to the next session. A short announcement. We have found an ATM card with the name Jumpala Ushashri. If it belongs to you, please come backstage and collect it. And also there is a pen drive which has been found. If it belongs to any one of you, please come backstage and collect it. As we move on to the next session, I now invite our resource person, Dr. B.D. Patel, sir, Chairman of the session, Dr. Shrikant Konkani, sir, and co-chairman of the session, Dr. Srinivasulu, sir, to please come onto the stage. I request Dr. Dipti to please welcome the chairman and the speakers with a floral welcome.
I request Dr. Jessica Monterio to introduce the chairman to the audience.
It is an immense pleasure to invite our chairman for the session and introduce sir. Dr. Shrikant Konkani sir is presently the principal and medical superintendent, Bhartesh Homeopathic Medical College and Hospital, Belgavi, Karnataka. Sir has an experience of 31 years professional experience, 30 years teaching experience in the subject of practice of medicine. Sir has held many eminent positions, to name a few: Member Senate, Rajiv Gandhi University of Health Science, Chairman Board of Studies PG, Member Expert Committee in Homeopathic Studies at Goa University, instrumental with other colleagues in redesigning CCH MSR 2013, elected member of CCH New Delhi from Jan 2016 to 2018. Sir has been recognized with many awards. To name a few, received state level Best Teacher Award in Homeopathic Faculty from Rajiv Gandhi University of Health Sciences, Bengaluru, Karnataka. Received Lifetime Achievement Award from Bhartesh Education Trust, Belgavi for the contribution to the organization 2018-19. Received Homeo Acharya Award for the year 2018-19 by Karnataka Qualified Homeopathic Doctors Association, Bangalore. We are glad to have you, sir, with us this morning.
Thank you, Dr. Jessica.
I now request Dr. Rinku to please introduce our co-chairman.
It brings me an immense pleasure to introduce our co-chairman for the session today, Dr. Srinivasulu N. Sir. Sir is practicing homeopathic physician since 1994 for 30 years. Sir has graduated BHMS from Bhartesh Homeopathic Medical College, Belgavi. Sir has established Sri Sai Sharada Homeopathic Clinic at Aarti Nagar, Bangalore. Sir is a life member of Karnataka Qualified Homeopathic Doctors Association since 1995. Sir is taking responsibility of treasurer of KQHDA since last 10 years. We are honored to have you here, sir. I request Dr. Srinivasulu sir to introduce our guest speaker, Dr. B.D. Patel sir.
Namaste to all. I thank KLE Society and the organizers for giving me this opportunity for chairing this session and to introduce our great speaker, Dr. B.D. Patel sir. So, sir is a legend in homeopathy and a learned person, and also is keeping on learning things. He never stop in learning, and an expert in computer applications in homeopathic field also. And we are all actually learning from him how to see the cases in the computers, how to apply the computer software. Many things we have learned from him. So that is the greatness of him. And apart from the homeopathy, regarding homeopathic field, whatever awards have been got, and that has been introduced already by the or as a chairman, they have been. So now, apart from that, he has countless presentations in the public life and public awareness programs like the significance of Namaste. And I also heard about that. It is very great. And also the significance of rituals and their significance of influencing on the human mind. Many things like such things he has been, uh, uh, publicly giving speeches. And he's a Vedantist. He's a seeker of truth, and that's what I can tell about him. And now today's topic is polycystic ovarian syndrome is more aggressive than cancer. How it will be, we will hear from him. Sir, the stage is yours. Thank you.
Once again, Shubhodaya. Still sleeping? Shubhodaya. So, see, half the audience is khali ho gaya. Koi baat nahi. We need not quantity but quality of listeners. See, in the first session, our Dr. Praveen Jain said, "You teach somebody fishing, and he will eat fish for life." So I'm making a little change in that. Praveen ji is there. Praveen ji, अपना काम हो गया, निकल गए, खिस गए, चलो ठीक है. I'll be teaching you to fishing also, but I'll also give you some fish each one, in each case to eat. Let us take up straight away. This is what today's scenario. It is much more aggressive than the cancer. Cancer आएगा तो पता लगाएगा तो मर जाएगा, जब छोड़ो उसको यार. But what about the ladies who are suffering with this? Lifelong they are having problem. And I'm sure people, especially the fairer sex sitting here, out of them, some of them may be having this problem. Let us take up. It is more dangerous than cancer. Awareness month is September. Let us know this, just information. And this started in 1935. You will find someone with PCOS every 2 steps you take. This is what somebody said it. Our latest findings indicate that in India, every 3rd or 4th woman is affected by it once in a lifetime. While both the conditions are related to the ovaries and both the cause hormonal disturbance, there are many significant differences between both of them. In PCOD, the ovaries start releasing immature eggs that lead to hormonal imbalances and swollen ovaries, among other symptoms. I'm giving a brief idea. We are not going to detail into that. While in PCOS, endocrine issues cause the ovaries to produce excess androgens, which makes eggs prone to become cysts. Which is more harmful? Is it PCOS or PCOD? First and foremost, PCOS is usually considered a more serious condition. PCOD can often be managed with just lifestyle changes. Yesterday also a lot of people were speaking on lifestyle, and many not even require further medical treatment at all. So if any PCOD case comes to you, you give medicine, whether it is placebo or whatever indicated medicine, but change their lifestyle and it cures, and you will be getting the credit. Can a woman have both PCOS and PCOD? Many women use both PCOD and PCOS interchangeably when both are very different conditions. Now this is a rough as just beginning difference. Normal ovary, you will see here, and a polycystic ovary. And this is an old statement. Global prevalence 2.25 and 26%, roughly 1 in 15 women worldwide. But this was in 2012. And today, things have changed. 36% of women in India are suffering from PCOS. Now the rate is 40%. Polycystic ovarian disease, you can see here normal ovary and here the polycystic ovary. In 1 in every 5 to 10 women in India are suffering PCOS. Between 1 and 10, 120 women in childbearing age group are affected with PCOS. Yesterday, somebody was showing a fibroid tumor getting dissolved by the pregnancy when we prescribe the right remedy. 4% to 8, sorry. Women are affected with PCOS worldwide is 4 to 8%. Now, how many, I don't know how many of you have seen this. The first photo is normal. The same lady when she developed PCOS, and it says it's like this. And this is Harman Kaur. The lady grew up with, had showed all the signs of a male person with beard, hair growth everywhere. How many people would marry such a lady? But anyhow, this is a wonderful couple. Now, this is normal cycle, you know, and this is the PCOS cycle, what happens. Now, let us take up some cases. This is what we talk of fish and fishing. Homemaker residing in Kolar, is in Karnataka, married for the last 5 years, no children, presenting complaints, pain in abdomen during menses since 2 years. Friends, whatever we are presenting the cases, it is not that easy. We may have spent more than 1.5 hours or 2 hours to take the case, but here I am presenting you just gist. That means how to catch the fish and also eat it. No children, diagnosed as primary infertility. Red clots, this was complaints in detail. Diarrhea, nausea and vertigo. Heaviness in lower abdomen. Severe depression. No interest in life. Wants to die due to pain. All these before and during menses. I also do not want a monotonous talk of mine. Anybody, when we say, you can say, sir, this is the medicine. It is not that I got this case. Think that you are getting this case and what medicines you can think about. Let us have a discussion. That would be easy. Diagnosed as polycystic ovaries, bilateral with primary infertility. Mentally very sensitive to comments of people around her. Anger on least provocation. Depresses as she is unable to conceive. You are getting all these symptoms. Now think what medicines come to your mind. Desires sweets, ice creams and vegetables. Any drug, sir, we can think any drug, my dear friends? Any medicine you can tell from aconite to zincamet. Yes, please. Pulsatilla. Good. Anybody else? Natrum? Natrum mure. Good. Very good. Aversion to meat. Now this is the case. It will go for 8 to 9 minutes. So it was in 98 we took the case. So I'll speak this because our Srikanth Konkani sir is very strict about the time. He knows that I'm a military man, but still he tells me. We'll skip this. This is what the ultrasound scan shows. Old reports are not there. Right adnexal endometriotic, mild hydrosulfing's left side. Appendectomy in 1986 due to severe pain. Aspirated for multiple cysts in ovaries in 1997. Multiple cysts were there and aspiration was done. Any medicine now change? She has consulted many gynecologists. For the last 2 years, taking homeopathic medicines from some other doctor in Malleshwara. Anybody? Any other medicine? सोचो यार. ढूंढो रे साजना, कहीं ना कहीं मिलेगा. Anybody from the first year to final year? As she has been under homeopathic since 2 years, all the possible drugs might have been given. We were programming and planning how to go for the treatment. Might have been used, and I had to be very careful in prescribing. Question is, why the earlier doctors failed? This was my question in my mind. We have to hit at the bullseye. Third aphorism says knowledge of disease is most important. That's what we discussed. I had to find out what is to be cured in the case and then prescribe. The dominating miasm is psychosyphilitic. The depression during menses was so severe that she wanted to commit suicide. Anybody? Any drug that strikes you? It can be right or wrong. Don't worry. No one will be failed. Only you need to just communicate with us. Flow only with pain. Think it over. Membranous dysmenorrhea. Any drug now? Red clots. Anybody? Shrir Manaso Yoga Paraspara Anugrahe, Vedas says. That is, mind and body influence each other. If your mind is not all right, body can go down. If body is not all right, mind can get upset. Anybody, any drug coming to your mind? Which you know very common, maybe first year, second year you have studied this drug. Anyhow. Simsifuga CM was given on 5/3/98. 8/6/98, that is after 2 to 3 months. Menses flow in 30 days. Earlier it was 5 to 6 days earlier, before. Pain in abdomen only on the second day. Next cycle was absolutely without pain. No depression, no loose motions, no vertigo with this time, that is placebo. 26/9, after 3 more months, her last menstrual period, LMP, was 12/8/98. Did not get her next period in time. 12/9/98 urine test was positive for pregnancy.
This time it has become positive pregnancy, right? Huh? Pregnancy is positive. When was this? 21st.
Last date was 4th of August.
August.
We waited for 12th September.
Oh.
Then we waited up to 21st. Then I took her to a doctor. She said it's positive. So you take this.
You are happy?
I'm
very happy.
Yeah.
Okay, get me the report. Straight to be given test to be positive.
Should I bring it in between?
No. Next time. You resign immediately. Bring it next time.
Gestation, this is the report. 7.1 weeks. This is the report. And you have seen here the date is 23/10/2. 98 patient came. She came back after only 4 or 5 years. And that too, they said another case to me, referring, they also didn't have the children, so you go to that doctor. They came to me. Then I said, I'll prescribe medicine only when the patient who referred you comes with the child. So they visited us.
What's your name? Meghana. ಹೇಗಿದ್ದೀರಾ Megha? How are you now?
ನಾನು ಚೆನ್ನಾಗಿದ್ದೀನಿ. Feel better.
You feel better? And menses ಹೇಗಿದೆ?
ಮೆನ್ಸಸ್ ಎಲ್ಲ ನಾರ್ಮಲ್ ಆಗಿದೆ. ಪೇನ್ ಅಂತೂ ಒಂಚೂರು ಪೇನ್ ಇಲ್ಲ.
No pain at all. No pain at all. ಸ್ವಲ್ಪ ಜೋರ ಮಾತಾಡಬೇಕು ನೀವು. So you are getting normal periods?
Normal periods.
And no pains?
No pains. No pains.
No pains. And this is the child? Huh? Do you call this as a homeopathic child?
Yes.
How about the activities of this child?
She is very active.
Very active. And what is she doing now? You are sending her to crush?
Yes. ಏನ್ ಮಾಡ್ತಾ ಇದೆಯಾ?
LKG.
Pre-nursery.
Appa ಹೆಸರೇನು? What's your father's name? Mahadevaya. What's your mommy's name? Huh? Hi, Genda Sundabai. That's lovely. Who's your mother? Show me. She's your mommy. Yeah, lovely. Okay.
So a patient cured is a customer lost. First day has to be taught, especially your Urjankars has to teach you this. Now, that is one. Next is insulin resistance. A pathological contributor in 50 to 80% of the PCOS cases, insulin resistance. Insulin resistance in primary cause in PCOS. Now, thing is, whether diabetes is first or PCOS is first, that is a question. Anda pehle ya murga pehle? Anybody can answer this? जो अंडा खाएगा वो मुर्गा पैदा करेगा. Anyhow, PCOD is metabolic syndrome with reproductive implications, thief of womanhood. I think many of my colleagues also may be facing. Friends, let me tell you, for the last 30 years, I am getting every month 8 to 10 cases of couples not having children. And there's a big problem we need to solve. And maybe my colleagues also will watch that. It is recent, it has become 30 years, 30 to 35 years. In Punjab, we had very few cases where, sir, bachche nahi ho rahe. Very few cases we had. But now in Bangalore, it is really going up. Now, expressing feelings, womanhood in India hardly express their feelings, of course, except those who speak English at home. General other people don't express. They suppress for the fear of society and security. Now this is a second case. Prolonged and heavy menstrual flow since menarche. Controlled only with hormones. Periods once in 5 months. Diagnosed as multiple ovarian cysts bilateral. Married since 3 years and no children. Headache, temples, and over the eyes, generally aggravated in the evening. Heaviness in breast before periods. Known case of chronic allergic asthma. Allergic to parthenium and dust. Frequent attacks of cold which stay for a long time. These are the other symptoms apart from the main symptom. Very sensitive to comments of others about her. Always suspicious about friends and relatives. Gets easily tensed up for petty things. Easy face greasy and pimples coming before periods. Anybody can think of any drug, you can just raise the hand and tell me. Did not get sufficient love from mother. Forsaken feeling. Guilty feeling for the death of her boyfriend. Very much hurt about it. Earlier, she had a boyfriend and he died, and she got hurt very much with the news of her death. Father died of heart attack immediately after her marriage. Obese, hot patient, desires sour things, aversion to milk, desires and aversions changing now and then. Any medicine you can think of, my friends? Any doctors, any students? Warts on face and neck. Anybody? Yeah, all are MPs, I feel. You know MP? MP means Member of Parliament is one definition. Muscle and power is another definition. But we have one definition here. Mute participants. Let us speak out, bhai, kuch bhi ho. Diagnosis of the patient. Obese, warts on face and neck, hot patient, greasy face, suspicious nature. Now at least drug bolo. Huh? Natrium muriaticum. Magnesium muriaticum. I think magnesium use is very common in these colleges. Huh? Somebody is teaching. Yesterday also somebody magnesium use. Today Praveen just said magnesium use. So let us see. Okay. Multiple cysts in both the ovaries And this is the scan report. Now, diagnosis of the patient. Guilty feeling for the death of her boyfriend. You can change the medicine, no problem. See, अपने हाथ में जो मर्जी करो. Polycystic ovaries, bronchial asthma, usage of excessive hormones, psychotic and tubercular dominant psychotic and tubercular, but dominant is psychosis. Now, Tuja, it's clear-cut case which can be easily thought of, so we give Tuja C here. Tuja. First time in her life, her cold was limited to 4 days. Otherwise, 15-20 days with antibiotics. Otherwise, it used to last for 15 days with antibiotics. Rubra means placebo. We have different words. I think my friend is sitting here, Madan. He knows all rubrum, placebo, xeroxanum, whatever you call them. Had normal periods on 1496. Ultrasonography shows no cysts. Feeling of some sensation in the abdomen at about 11 a.m. Excess sweating of the palms and soles. Desires loneliness. Even husband's company irritates her and she is jealous. Sexual desire less from the beginning. So some of you said, wonderful, no, magnesium, it's natrium. Magnesium natrium, bhai hai, koi baat nahi, chalega. Periods very normal, once in 30 to 32 days. Not many clots. Perspiration much less. No pain in breasts. No vertigo on closing her eyes, which was there earlier. Menses regular and flow for 5 days. The sexual desire has increased. This is what her husband told me. So now she is more cooperative. मैंने कहा cooperative क्या? When you bring less money, she will cooperate. No, sir, आप नहीं समझे. You try to understand. She's very cooperative now. समझ में आ गया? That's what it is. The stools are normal. Earlier stools were passed in installments, like LIC installment. And she had a feeling of stools receding back. Again, this is a sign of psychosis. One more ultrasound scan was taken to confirm the cysts, which showed normal on pelvic study. And this is what it is. You can see this. Pelvic, last one, impression, normal pelvic study. Now, clinical manifestation of PCOD, just slightly I am giving this. Acne, acnotosis, hirsutism, obesity, irregular menses, hair loss, infertility. Just for information. Now, this is a third case. She's a garment business lady, ovarian cysts, presenting complaints, dysmenorrhea, pains too severe, it's 4 marks. Leukorrhea, creamy color, leaves stains on the linen, yellow color, aggravated by bending forward. Dandruff and falling of hair in general, including from eyebrows. Heavy and painful breast before menses, better by flow. Strained relations with husband, maladjustments. This is what is happening most of the youngsters. Today youngsters don't marry each other. Only lady and leda marriages each other. लड़के का उम्र होता है 35, लड़की को 30. Sir, we have to understand each other, so we will not have children for 3 years. So after that, we'll think of it. Please don't think of it. You will never have children. Age difference between husband and wife is more than 10 years. Dreams of death, funeral-related dreams, snakes, and intercourse. She gets the dreams of intercourse. Involuntary urination on sneezing, coughing, and strenuous work. Whenever she does, few drops come out. Allergic sinusitis. Very sensitive, feels like crying, but only when alone. Any medicine? पल्सोटिला, नैट्रेमूर और कोई चीज. अब अपने बाप का क्या जाता है यार, कोई ड्रग बोलो. Doesn't like milk in any form. Avoids intercourse as she has no interest in it. Rather, she hates it. Any medicine now? Cannot tolerate if she is ignored. feels nausea and headache whenever she is sad. You can see the symptoms. She is quite fat with 2 children. History, calculi ureter for which she took laser treatment, which led to many complications, including many complications. 1 induced abortion, ruptured ectopic pregnancy due to laser treatment she feels. Any medicine now? Right ovary and tube removed, also had appendectomy. Left ovarian cyst, you can see that. Used now, how we went to, our approach was, used hormones for many years. So we gave on 21, 2000, Sepia 1M. She is much better overall, mentally relaxed. No involuntary urination during cough and sneezing. Leukorrhea had become thin and not much. She said, "Sir, now I do not feel aversion to intercourse." The first time a lady coming and speaking to a male doctor, and that to Sabia Ahmed. She said, "Sir, I don't feel now. It's all right. I'm comfortable." Had periods yesterday without much pain. Ultrasound examination on 10th shows no cysts. 2003 periods normal, flow satisfactory, but the pain in breast is persistent. Again, placebo. We never change the medicine. Now you can see this ovarian cyst seen on the earlier scan are now resolved. She did not get her periods, but all the premenstrual symptoms with pinkish flow. Mentally, she is upset due to behavior of her husband over petty things. So we had to prescribe steps I agree. Mentally much better, more relaxed, getting her periods near to normal, no premenstrual syndrome, headaches much less and tolerable. Conclusion, the patient is directly asking, please give me sepia and save me. If you take the case proper, that itself will give you the indications. She developed the desire for intercourse that shows the drug is correct because it is the first grade mental symptom. It is the basic instinct and of high value symptom. Later on, needed staff to remove the persistent block with her dominating husband. Do you think that all husbands are dominating? Except me. When the case is clear and guiding towards the drug, do not repertorize. If you repertorize this case, na, पता नहीं क्या क्या निकल आएगा. Pathophysiology of PCOS, a little bit we'll do. Hypothalamic pituitary axis, there abnormality, androgen excess, and here chronic ovulation problem. Now let us see how the miasms work on this. PCOD SORA initially brings about functional changes in the form of neurohormonal pathway leading to hormonal changes. Psychotic miasm brings about pathological changes in ovaries leading to formation of cysts. Tubercular miasm bleeding from the cyst. And syphilis leading to malignancy of any of the sexual organs. What causes PCOS? Genetic and lifestyle. Hormonal changes happen, androgens, hair growth, all these things we have seen, and you can go through your medical literature. This report, have you seen? Try to understand this. Somebody sent me this report. Liver, she has normal size and shape in seen in right kidney. She has normal size in shape in seen in left kidney. Everything is normal. Ostamich, she has some heat in ostamich because she has some sweat at this side. This is the ultrasound report sent to me. Okay, the lighter side of this. Now this is another case. Homemaker, migraine since 3 years. I think I would skip this case and we will go to the last case and then we'll talk on. Yeah, this is one case I want to show. Please be careful and try to go through this case. Are you with me? Yes. Neha Nupur, 24 years, software, ovarian cyst. This lady first walked into my clinic after contacting my assistants number of times. She called number of times, she took appointment, cancelled, took appointment, again cancelled. She called many times and repeatedly made sure that I will only see her and no assistants will be there. When she came for consultation, she insisted in the receptionist that there should be nobody inside the chamber except me. So especially seeing a lady alone is very dangerous today. All the male doctors should be very careful. Anything can happen. Receptionist informed me all this. I thought she may like to tell or talk something in confidence. She came for severe pain during menses, dysmenorrhea. The menses are normal without much delay. When I asked her why she needs so much privacy, is there something special? She said, nothing much, but I don't want to discuss anything with the people who are not to my standard. Okay? मैं अपने बराबर वालों से ही बात करती हूँ, पसंद करती हूँ और किसी से बात नहीं है. Pure vegetarian. I think more of vegetarians have this ego problem. Huh? इसका मतलब ये नहीं कि मीट खाओ, मीट मत खाओ भैया, उसमें तो कुछ और हो जाएगा. Just joined the job, no much pressure in the office, no family history of dysmenorrhea, no disappointments in life, regular food and sleeping habits, etc. No, on repeated asking, she revealed the following. 3 months back, one incident happened. The maid in the house spoke very badly and insulted me. I can't throw her out and I can't shout at her. Any medicine? Bolo yaar. Case is so clear. Beretta carb. Huh? Platina. Anybody else differs? Huh? Stephysagria. Okay. Both are right, no problem. I did not want to shout at her as it is below my standard and dignity to fight with a servant. Are you getting my point? Not that in Bangalore you don't get servants, but it is below her standard to talk to a servant. I cannot forget the incidents, nor I can tolerate it. I don't understand if it can help you. By the way, what is the relationship? She asks you, why are you asking this question? I have sent you the report. It is there. You give medicine. Beyond this, I don't have anything to tell you. She was very young lady and very fine. I don't have anything to tell you. Come on, give me medicine. Many people talked too high of you, so I came to you. She came to me because people had talked high about me. You are taking so much time? Nobody asked me so many questions. How would you handle such a case? This is what I'm asking you. So two drugs came, Platina and Stephysagria. Anybody else? Don't hit that boy, yaar. He's going to practice nicely. If you hit him, he's on the head, he will become mal-headed. What could be probable remedies? Think it over. See, you don't know. They told you that I'm a principal, director, dean. So I keep my eyes to here and to there also. I know what is happening there also. I gave Colocin 30. Enlarged right ovary with complex cystic lesion. That is the report. 18/7/14, the pains are less but not completely gone. I thought in one dose everything would be all right, but I had to come again and again. The lady is asking. The pains are much less compared to last time, but what is this? I have to come again and again. With one dose you should cure. Your name is so high. Give some good medicine which goes well with your reputation. This is how the patients are. So we gave, as somebody suggested, because I was only thinking after listening to you, I gave Platina. She has been transferred to Kolkata and she mailed me from there. I think the last medicine was the right medicine. Forget about the pains, but I feel much light and more energetic. There has been some arguments with my subordinate. She is a software engineer, but I was able to handle it without disturbing myself, not with disturb, without disturbing myself. But I feel subordinates should know how to behave with the. I asked her to get ultrasound scanning from there. She did and sent scanned report. The cysts are removed. This medicine, she's telling, this medicine you should have given me first time. And anyhow, I thank you very much. She keeps referring patients. By the way, Platina doesn't cover ovarian cyst. Go and check it up. This is normal study. She took it from Calcutta, somewhere else. Yes, Darbhanga. She's in Darbhanga. Can PCOS be cured? No cure, but very effective treatment options for managing the associated problems. Removing the cyst does not cure the problem. Lifestyle changes is a must. Homeopathy, first line of treatment for all PCOS problems. Don't subject the poor lady to hormones. Poor lady, I don't mean by money. Poor lady by her health. Now, this is the important part of my presentation. That's the reason I cut down all the. So I'll take 50. You said 40. I'm asking 5 minutes more. It is only 12:30 now. Just beyond medicines. One of the first duties of a physician is to educate the masses not to take medicines. William Osler, father of modern. Are we doing that? Are we doing that sincerely? Just tell me. Many of the girls are here, ladies are there. Please make it a point. Now, don't ask why healthy food is so expensive. Just ask why junk food is so cheap. Eating out, it may be hitting 10 minutes. I know that. I am a military man, by 10:40, he said. I asked 5 minutes extra. This is important for them. Yes, I'll stay. Eating out may be hitting your hormones. So many of us, weekends. We go out for weekends. What do you call weekends outing in Marathi, Hindi, Gujarati, Marathi, Kannadi? You have no word. This is a Western concept, and especially software people have this. The society which serves the spoiled food is civilized society. The fellow who is selling healthy thing is uncivilized. First, they create this problem. Many of you youngsters are eating a lot of chocolate, I have seen. They sell this solution afterwards. Now, change lifestyle. Healthy lifestyle. First, stop visiting malls. Lulu Mall is coming up in Belgaum also. Stop visiting that. Get out of mall culture. माल में माल है, माल खाने को माल नहीं है, जिस्म गया तो माल खत्म हो गया. Most important part, youth have stopped thinking. Don't use anything that is advertised in the TV. Pizza खाओ, यहाँ से चूस के निकालते हैं. Noodles. Tomorrow there will be a TV ad. Dr. Patel is the great doctor. That means idiot, he doesn't know anything. Good and healthy products are not advertised. Have you ever seen in any TV, झुणका खायचा, येतं का? नाही. नारळचं पाणी पियाचं, येतं का? नाही. इडली खाओ, नहीं आएगा टीवी में. This shlok, you take it from Bhagavad Gita. Yukta ahara viharasya, yukta cheshtasya karmasu, yukta swapnava bodhasya, yogo bhavati dukkha. Open this, it is in 6th chapter, and I would not explain this to you because I want you to read it. There is no God. Now, this is what is youngsters. How nice, how beautiful they are. Huh? And you copy them. Phatawa gene, iska paisa kitna, you know. This is cost is less, this cost is more. क्या जमाना है यार, तुम लोग ये नहीं है क्या, फाड़ के तुम पहन रहे हो. Okay. Now this is that. Please, okay, our sir is waiting one time. Please open your mobiles after going home. Tight pant syndrome, you see this? You will understand what it is. Tight pant syndrome. Lot of urinary problems are coming up because of this. Lot of UTI, males and boys and girls. Infertility is one of the reasons for tight pant syndrome, and that too when you wear it jeans. The best dress in the world is sari. Next is salwar kameez. And for males, dhoti, kurta. I was to wear dhoti, kurta. Udchankar said, dhoti pen ka hai to andar nahi aane denge. You are a great speaker. Okay. Anyhow, I'm not going to take this. Jeans have so. Please open. Tight pant syndrome. That's it. You put it, you'll get on Google. Baba Google will explain everything. Now, this is what it is. You cannot sit with the tight pants. See, friends, there should be aeration. And now I'm talking openly, which I can talk at this age. Don't use pads. So many huggy pads, what are pads? Safety pads. क्या pads? You बोलो भाई क्या use करते हो? You use. I know that. You know the pads. What is the harm with the pads? I'm talking medically. See, there is no aeration. They will put silicone layers into that, and they will not allow anything to come out. That is the first disease. Just see, 2-3 generations before, they never used pads. They used cotton cloth. Cotton cloth is aeration. You can take, wash it out. Here, how much of throwing you are doing, how much of the ecological problems you are creating. I tell this in most of my presentation. This is most important part of my presentation. Please educate the people. You may laugh at me, but go and think. The pads have a layer where it will not allow anything, so no air can grow. Anyhow, this is the best gym. Sasuma ka gym hai, where you have all things where you can keep yourself healthy. Now, anyhow, this I'll skip. See, earlier, they were having 20 children, 10 children, and they were maintaining their body structure. Today, one child, two child, doo. Now, please do yoga. Don't go to gym. Have you seen this? When I can do Shirsasan, why can't you do Padasthasana? Do that. It will save you a lot of your health problems, so a lot of money. Anyhow, I'll skip. Marriage age. Please think. Marriage age is between up to 25 for the girls to be healthy married. No, sir, I want to PG and I have to work with the Udchankar sir and take training, then I'll think of marriage. Don't think of marriage, then be with anybody. Use earthen pot for water. Minimize tea, coffee, including green tea. Green tea will not reduce your weight. Think it. You can challenge me. No factory manufactured food. Use fresh food, cooked food. Yesterday there was a nice party. I ate that what you call rumali roti, and it didn't pass my motion today. Eat raw salad, including onion, and then food. Coconut must. Fresh seasonal fruits should be part of your daily life, daily food. Now, these are few asanas. Please write down or make a note. Bhujangasana for PCOS and other problems. Ardhajanu Vajrasan, do that. I'm showing all ladies only, you know. Adhomukshwanasana. Janu Shirshasan. Baddha Konasana. Don't call butterfly asana. Don't call that. That's a very wrong word. You should use the word Baddha Konasana. The pronouncing of that word itself will create pranayam, will create a sensation from your umbilicus. Paschimottanasana. Shalabhasana. And this is Chakki Chalasana. You know, Chakki, this is a new one created, but it's nothing. Sit with your head and do this. As if you are doing a Chakki. Navasana, one of the best asana for diabetes, PCOD, and thyroid. This is Dhanurasana. Matsyasana. I'm not telling English names. You should never learn yoga in English language. Itna ghatiya bhasha hai, which is very slang. You cannot substitute any English word for Indian words. And this is Chakravakasana. And this is what you find in my clinic. You can see this, building immunity and don'ts. Especially don't see Big Boss. How many of us, you tell me, anyone tell me, I'll give you 1,000 rupees now. What you learn from Big Boss? वो थूक रहा वो दिखा रहा है, वो पैंट पहन रहा वो दिखा रहा है, वो झगड़ा कर रहा वो दिखा रहा है. See something which is good, which is, it's not entertainment. This you do every day in the life. Americans do, Hindi people do, Telugu do, Kannada do, Marathi do. Kya yaar? How much time you waste? And I was really shocked to see the Bombay fellow who got Big Boss #1, and he was, they're jealous. And that fellow is an anti-Indian. Let me tell you openly. He comments on India like anything. Okay? Now, any more questions, sir? I am in time, 12:40. Any questions if you permit? Otherwise, thank you very much for giving me this chit.
Thank you, sir, for educating us through various cases of PCOD. I now
You are
invite
telling routinely. अरे कुछ सोच के बोला करो यार.
I now invite Dr. Shripad Hegde sir for his session. I request Dr. Bhumika to welcome sir with a flower.
I request Dr. Srinivasan to introduce our speaker for the session.
Namaste. Professor Dr. Sripad Hegde, sir, former professor and HOD Medical Government Homeopathic Medical College Hospital, Bangalore. A member, a special committee for drug proving of CCRH, Ministry of Ayush, Government of India, New Delhi. A member, Governing Council, National Institute of Homeopathy, Kolkata. Director, Tattva Homeopathic Research Center, Bangalore. Guest, guest faculty, NHRIMH, Kottayam, under CCRH, Ministry of Ayush, Government of India. Sanchalakru, Sri Bharati Arogya Dhama, Hampi Nagar, Bangalore. President of KQHD, Bangalore. Qualified MD Home, MS CNP, PGDHA. Teaching experience 35 years, practicing experience 39 years, and scientific papers present in various platforms. 10 international presentations, 50 national presentations, written many articles, books, and gave expert talks on various topics in TV and radio. Traditional dance, drama, Yక్షగాన artist. I welcome sir to take the session.
Very good afternoon. I hope lastly he said that I am an artist, Yક્ષગાન artist. I am not in that costume. Otherwise, would have performed that better than that to wake up you. And let us see something very interesting. And I think out of the box, it's not a routine thing, but I'm going to discuss with you. That is neuro-ophthalmic manifestation of intracranial space-occupying lesions case studies. Rarely we get an opportunities of such cases to treat. Only certain occasions and maybe challenging when everything fails, or is there any hopes or a possibilities in alternative system or in the complementary system, then they will come and approach. होम्योपैथी में कुछ है क्या, होम्योपैथी लेना दिया ಏನಾದ್ರು ಮಾಡ್ತೀರಾ, means they are not confident, and I think to say that we are also not confident to say yes or no in the beginning only. See, so many literatures we study, so many subjects we study, everything there is a cure or a treatment to hear, but we should need a evidence. We could able to get a confidence only by experience. We could able to gain that. And here today I am discussing with you in short, because when the challenges are there, I hope I am there. Sir has given me a task that within 20-25 minutes, whatever you want to say, you have to finish in the time. This is also like that. See, try to understand what is that. There is a pressure, intracranial space occupying lesions. The only organ in our body is the skull, which cannot be expanded unless and until there is a scope for that. And under that, even a minutest growth occurs, the problem starts. And many times it is the beginning with headache. See, what are all maybe the possible things which could able to cause the space occupying lesion in the brain. And all the headaches, or many times the headaches have been taken at maybe a different cause, or if the cause is not known in the initially, considered as it may be a migraine, a vascular headache, or bilious headache. So many designations we give. And these are all the causes like a primary brain tumors, metastatic lesions, hematomas, cerebral abscess, lymphoma, granuloma, tuberculoma, cystosarcosis, like that. This is a very simple physiopathology. You could able to understand the space occupying lesions. The brain and spinal cord are enclosed by bone, hence expansion of their contents by a space occupying lesion leads to compression and distortion of the tissues of the central nervous system. See, what are all these space occupying lesions can take place. One is a benign tumor, maybe a malignant tumor, or maybe an abscess. Slowly enlarging space occupying lesions can be accompanied by atrophy of adjacent brain or the spinal tissues, and that will have an impact on the body organs as well as the functions. Generalized symptoms and signs. Usually, this is a common thing usually we see. The headache is the prime symptom we see. Vomiting may occur, may not be. Sometimes only the nausea or change in mental status or a behavior changes. All these things, they varies from case to case. There may be a weakness, ataxia, or disturbance of gait, even deficit of speech or a vision may be a poorly localizing signs. There may be generalized convulsions. I'm little fast. Please come with me, because these are all the manifestations. Usually we see the common manifestations. And generalized symptoms, what I was talking about that. Many times, see, the cases when we come, I will tell you how the things can be seen and the presentation will be there. The signs and symptoms of a brain tumor vary greatly and depend on the brain tumor size, location, and rate of growth. New onset or change in pattern of headaches. I hope you followed it. Pattern of headache. That's why that word is used. Headaches that gradually become more frequent and more severe. Unexplained nausea or vomiting. No cause, not known. And vision problems such as blurred vision, double vision, loss of vision, or periphery of vision, field of vision. It varies. Gradual loss of sensation or movement in an arm or a leg. Difficulty in balance. Speech difficulties, confusion in everyday matters, personality or behavior changes, seizures, especially the convulsions, may be the first symptom of this space occupying lesions, or sometimes maybe hearing loss or impaired hearing. All these things will come. Then the study of this is where we could able to show that we have a scope, and by the same time we should know the limitation also. Explore the homeopathic treatment and management, what best we could able to do for such type of intracranial space occupying lesions, constitute a major reason for seeking neurological and ophthalmic consultations worldwide. Remember, many ophthalmic problems is the gateway to go to the brain. Many times they go to the ophthalmologist first instead of going to a neurologist or neurosurgeons. And understanding the clinical manifestation of these lesions is complicated due to the extreme heterogeneity among these patients, and management depends on various factors which include the size, location, and duration, pathology, and rate of growth of these lesions. Neurological symptoms may be caused by their mass effect on the surrounding structures, raised intracranial pressures, and expression or a suppression of various hormones by the tumors or due to hydrocephalus. Here I am concentrating mainly about the tumors. Space vacuum lesions may be varying. Even we could able to see the late effect of the microhemorrhages or the hematoma formation. There is also a space occupying lesion, but it all varies from the causes. Eye is considered as the window to look into the brain, as developmentally the visual system is an outgrowth from the central nervous system. The projection where the physiology is being made like that, where morphologically and functionally the visual system as a whole can be called as the little brain, the whole the ophthalmic system. That's why ophthalmic manifestations in intracranial tumors such as decreased visual acuity, visual field defects, ophthalmoplegia, papilledema, and optic atrophy may occur as an initial presentation in about 46 to 88% of the patients due to raised intracranial pressure, compression on the visual pathways, cranial nerves, or orbitoocular tissues, or tumor infiltration of intraocular structures or adnexa. About 60% of these patients present to an ophthalmologist with ocular complaints. To try to understand this. As the ophthalmologist would able to guide them where they have to go. They have an important role in the early diagnosis of these cases for immediate referral and prompt management. The purpose of the study is to evaluate the neuro-ophthalmic and clinical characteristics. Ophthalmic manifestations, I have told, I skipped this. Gliomas, meningiomas, acoustic neuroma, pituitary adenoma, medulloblastoma, primitive neuroectodermal tumors, germ cell tumors, or craniopharyngioma. These are all the rare things. Like brain tumors have more than 120 different types, according to the National Brain Tumor Society. Some brain tumors, such as a glioblastoma, are malignant and may be fast growing. Some are very slow growing. Other types of brain tumors, such as a meningioma, may be slow growing and benign. And some of the tumors are so like that even after surgical removal also they grow slowly. It takes its own time. See, these are all the different the areas, the location wise, the names have been given: meningioma, oligodendroglioma, astrocytoma, supratentorial ependyoma, optic glioma, astrocytoma, craniopharyngioma, pituitary tumor, pineal region tumors, schwannoma, and brainstem glioma, ependyoma, medulloblastoma, cerebellar astrocytoma. See, brain cancer types: chordoma, chondrosarcoma, medulloblastoma, olfactory neuroblastoma, lymphoma, gliosarcoma, melanoma, rhabdomyosarcoma, paranasal sinus cancer. Non-malignant tumors make up a majority of this type of space-occupying lesions. All the brain tumors are not malignant. Try to make it. American Brain Tumor Association, just 1/3 of tumors diagnosed in adults are found to be malignant. Remaining all benign tumors may be giving a little things. And treatment for space-occupying lesion. Just to imagine where inside the skull, the brain is there, a growth is there, how the pressure can be reduced. That is the challenge for the medical science. Treatment strategies for space-occupying edema includes pharmacological anti-edema and intracranial pressure lowering therapies, ventricular drainage by means of an extraventricular drain, or suboccipital decompressive surgery with or without resection of necrotic tissue. Then, what is the best cure for brain tumors? Surgery is the most common treatment. I'm not advising you, but that is the most common thing, which is there are numerous surgical approaches to remove brain tumors depending on the size and location. Homeopathic treatment is best for some variety of cases, depends on location, sensation, modalities, and other features. See, it all again the varies. And this is a very interesting the way of treatment, where in many neuro centers now in Bangalore, many multi-speciality hospitals they have started. Earlier, it was available only in the Nimans to the Bangalore. So later, interstitial thermal therapy, very well advanced. You know, they could able to locate exactly the location where the growth is there. They could able to reach there, and they do the radiation, all these exercises they do. Very rare. I have seen only one case. Whether the patient is lucky or I am lucky to that case, where she had a, you could able to see the color on the right eye, surrounding the right eye. It was there from her age of 10 years. Earlier, it was not there. A typical purple color was there, and melanotic changes on that side of the face, head, as well as on some parts of the body. It's a typical thing. But they were coming to me as I am a family physician for them. But one fine day, she came with a complaint that I see everything 2-2, double visions. That was her complaint. And words move. As usual, everybody thinks I also thought that there is some problem with her eyes. I never thought that there may be some growth inside. Because she was fine all along. And fine, sudden morning, she has developed, and evening they came to my clinic. And when I saw I didn't get it, I said I have referred to the ophthalmologist. And ophthalmologist immediately said, no, there is something wrong with the brain. When she went, they diagnosed her as melanocytoma. I will show you how while the melanocytoma is generously considered to be a benign tumor, it has a potential for growth, recurrence, and transformation to a malignant melanoma. We never thought. So young lady, very rare case. Leptomeningeal melanoma is an extremely very rare type of primary intracranial melanoma with a global incidence of 1 case per 20 million. Just remember, 1 case in 20 million. This is a very rare case. So just I wanted to share with you. Chief complaint was she came with a sudden onset of double vision and floating of the words. And consulted the ophthalmologist, neurosurgeon, oncologist. A city like a Bangalore, once they go away from you, they may not come back to you. That is the usual trend. But where, as I said earlier, see, they come back to me for each and everything, sir. We went to ophthalmologist and he guided us to Niemann's, neurocenter. They gave the report, a very rare case, malignant melanoma with meningeal, dural, and pericranial involvement. See, so young age, you could able to see 31 years. Young age. Hardly, I think some 7 or 8 months child was there when she came with this complaint. And she never expected. I never expected. See how it was indicating that discoloration on her face and this color, maybe that the melanoma hardly we see. See, from Niemann's, she has referred to Tidwai. It's another institute in Bangalore. They removed and they gave the interstitial laser therapy, what I said. After that, the challenge is there with us. Sir, they told us they have removed almost all 99%, but they are not very sure 1% may remain. And it may grow, it may take its own time. Since 2013 onwards, she is under observation. There is no recurrence. I'm not asking you which remedy you are going to give, but this is what I give or I'm giving. Because very difficult to decide. The veratramir was the similimum which has been given, where symptomatically there was some relief, but it was a tough job. But remaining things like a calcareous conium crotalus is on observation for last 10 years. Even the last week also, they came. They are afraid. Her husband says that, no, if we go to the hospital again, they will say, no, we have to do this, that, and all. I said, at least for our study purpose, is there any growth is taking place or it is arrested? Please go and do the scanning, sir. And hogala, sir. Or matte ಏನೇನೋ ಹೇಳ್ತಾರೆ. See, that fear is there because of late the medical practice has become so like that it is more scary to enter to any hospital, how it goes. And when they enter, very little changes also, they say that, no, tomorrow you may get another major problem. Better you, now only you undergo this, that is the practice. I don't know. Please don't follow, all of you. Many juniors are here. She is on observation and she is fine to say that. Okay, this is another case. Only the rare cases I am discussing with you. Such like that, many cases we might have seen. Because hardly you could able to, I don't know how many you have seen. Some seniors might have seen such cases. One you have seen now, malignant melanoma, that is also in the meningeal melanoma. Outside melanomas we have seen on the skin or other parts. But inside the brain, it was a tough job. This is another thing, the schwannoma, vestibular schwannoma. This is also a very rare case. Hardly we see. And here also the first presentation was actually the drooping of the eyelids and she could not able to see anything. I'm telling you how the manifestation started from the ophthalmic. That's why I said the neuro-ophthalmic manifestations are very, very important. We should see what may be the problem with them. Then when they did a scanning, it was the situation, she could able to see. They did a surgery, and during surgery, she lost hearing as well as palsy on the face. And it was on continuous observation. You could able to see the faces that have not masked it. Okay, it's open. We are all medical practitioners, we know. And patients have to accept the things. And I don't think there is no legal obligations will come. See, again here this was the medicine. Iscam album, pulsatilla, conium, thuja, and medorin. You may have now more than 100 questions at a time in your mind. I think during lunch hours I will discuss with them, sir. Why so many medicines least I give? Okay? I don't know. If the question has not arisen, you are not a sincere homeopathic, either a student or a practitioner. This is another case. Very severe headache. I said all these patients, the approach will be different. A lady of 30 years. The headache was there, and it was a typical presentation like a migraine. Any migraine patients, how you see, they like that. 30 years old, very happy life, leading life with a one child, normal delivery, and other things were. There is no other pressure or attention or anything. Headache, headache, headache. Okay, and she responded very well for the treatment. It went on for 5-6 months, almost 1 year. And I also thought, okay, they are fine. Then what happened? What earlier I was talking about the presentation, how it increases, her the headache frequency started increasing. Intensity started increasing. She started telling that, sir, I could not able to tolerate. Almost now every day I am getting the headache. Earlier it was once in a while, and it used to be there for a day or two. Then it used to vanish again after 2 months or 3 months. But it is not like that. Now every day I am suffering. I cannot tolerate. Then that is the moment I thought, okay, let us do the scanning. When the scanning has been done, we could able to see. I hope by this time you might have read. Pituitary, macro, adenoma. See, we never think that, no? See, this is the field vision on 9/1/22 and 22/10/22. Can you able to see the changes in the left eye? Her complaint along with that headache, she could not able to see the one side. That is very clearly marked in this vision field. I said, no, whenever the headache is there, naturally, even when they don't respond for the medicine, and we take opinion, maybe the headache, maybe, because there is 1,001 cause for headache. Very simple, eye strain to the even constipation or retention of urine or so many things, or naturally all the vital organs, or maybe the cause is ear, nose, throat, the sense organs, like that. Then we think first maybe the ophthalmic problem. Then when the field vision is there, and see, her constitutional medicine was not removed. Classically, how we study, taking history and all these things, it was very clearly indicated remedy. Acute medicine, I have used like this belladonna, iris, and so many other things. Then she used to get a relief. You may not believe, even the throat night, she started complaining. Because earlier she has responded, I was in that impression only, okay, she's getting relief. Then why it is not? In between, she did get a sleep also. Then I gave some time in between passiflora also. But out of all these things, her headache continued, and with all these things, and they did a surgery. Because we're helpless. The headache became so severe. But after that, the surgeon said the same thing. You have to keep a watch over that. Yeah? She may get back the problems again. And this is on January 12, 24. We took a CT brain. It is there, but it is not growing as per their expectation. Here we have a role to arrest the further growth and take care of the patient. Patient is fine. Her field of vision also become normal. She could able to see clearly, because once the removed the pressure which was falling on the brain tissues, she could able to see. This is the another case. Here, little detail discussed. We are 51 years old, man, software engineer. Again, presentation is headache. You know, in the software engineers, the headache means that is headache for us. And a city like Bangalore, Mumbai, or any cosmopolitan cities, they are more. They deal with the softwares, but we have to deal with very hard stuff. That is their headache. And it may be because of many, various reasons. Because continuously they are seeing the system, even without blinking their eyes. It is a, what we say, the dry eyes and spondylosis, or maybe sometimes they put a that earbud, so many things. See, you could be able to see they are flying to sky. That is the situation, though they are in the office only, in the AC room. Because of the AC, because of the ophthalmic strain, or because of any other reasons, they are getting headache. It's very difficult to us. Here, this person came with that headache on and off, shooting pain, mostly on forehead, sometime on vertex or a temporal region. Initially more in the evening, sometime nausea or vomiting sensation, but he never vomited. Aggravation by exertion and becomes severe by the day passes. Aggravation by stress and night watching. Familiarization by evening and lying down. Familiarization by tight clothing the head. Past history, had on and off headache, again the same, and he used to take some painkiller. Then somebody said, no, that is not good. Your kidney may get spoiled. Don't take that. Father died due to stroke. Mother is diabetic. Personal history is appetite good, eats more. Urine and stool normal. 6 to 7 cup tea naturally because they are sitting continuously. No smoking, no alcohol. Luckily, that is all not there. Chilly patient. Body weight you just observe. Only 115 kg. I don't know, maybe almost double than me. Patient as a person, obese, easygoing, sedentary life, eats in odd times, natural, no exercise, considering as a migraine, treated him. What medicine can be given to him? The patient is in front of you. I gave a little detail. Out of all these 3 cases, this is the 4th case. I gave you so many informations. Now the medicine should be able to come to in your mind. You can suggest some medicines if you thought of. And the case is the same. In the beginning, he responded for the treatment very well. Then he started complaining, some disturbance in his vision. Then again, I refer to the ophthalmologist as usual. See, he consulted ophthalmologist, he referred to neurosurgeon. The same pathway, just what I was telling about all the 3 or 4 cases. See, this is MRI brain on 19/2/2016. What it suggests, see. Supracellular predominantly cystic, peripherally enhancing lesion, striding the pituitary gland, deflecting infundibulum posteriorly and abutting optic chiasma. See, exophytic cystic pituitary macroadenoma or a typical rathecleptist. This is the scanning report. What is this Rathke cyst? They are benign fluid filled growths that develop between the parts of the pituitary gland at the base of the brain. The rathecleptist is dangerous, non-cancerous formation and are usually not dangerous, but however, they may affect quality of life if they press on the optic nerves or a pituitary gland. Larger cysts, more than 1 centimeter in maximal diameter, may cause visual disturbances. And symptoms of pituitary dysfunction and headaches and do often require surgical removal. This is what the literature says. But what we see, this is a field vision on 29/2/2016. Can you able to see the difference? On the left eye, that is right side, right eye is normal, left eye field vision is disturbed. You cannot able to see. See, this is the more clear picture on 8/3/2016. What we'll do, we'll take up this case or we'll send back to the surgeon. Patient is in front of me with all these reports, saying that, sir, they are advising me where I have to undergo surgery. Is there any medicine in homeopathy? Can you treat this? My vision is already affecting. Because I am a software engineer, without my eyes, I cannot work. And the headache is continuously going. What will do? See, making a trial is very difficult. Initially he responded, later he is not responding. And such cases are very rare. Whatever the cases, 4, 3 or 4, what I have shown, a very rare cases, hardly you see. Because such cases many we have seen. I remember one of the case, maybe some 15 years back, a meningioma case, when I was in the service in the college. One of our attender by Kotaya, I think Prakash Kumar sir knows, or even Madan sir knows. He brought one child actually, where meningioma, there they have removed actually. After 3 years, again he started getting the convulsions and as well as headache. And we could able to treat, we could able to correct it. Still that fellow remembers, sir, you know, see, I don't say no. Like that, many cases we have treated in this long experience of our practice. But these are all the rare cases today. I thought let us select and discuss here. We'll go ahead. See, this is a field vision 2516. Because we are worried what changes are taking place, whether it is a fast, whether it is a troubling the patient or no. We kept on observation, and the surgeon also said, we'll wait. See, neurosurgeon advisor for surgery. What may be the simillimum? What is the miasm? All these things I think you will think over. And what are all the medicines at least? Okay. Name of the medicines in any line. You say the psychotic remedies are help. No, sir, syphilitic remedies will help. No, sir, psoriatic remedies will help. No, sir, altogether you can give something will help. You have many options. And many schools are there. Many thoughts are there. Many ways of approaching for the remedies there. And many repertories are there. Many, what I can say, gurus are there. I use, sir, am I right? Many gurus are there. Huh? I don't say the godfathers. Only God is a father. There is no godfather. See, this is a repertoire, a simple repertorization. I did it, considering the patients, some of the complaints. See, what are all the medicines came. They're very interesting. And I don't know how many of you know, except the junior, the students, the seniors, Brahina is one of the very interesting and important remedy in treating the headaches. We think more about belladonna, natramur, spigelia, sanguinaria, aconite, all such things. Hardly thinks the Brahina, many of doctors. A very interesting thing here. And it was a typical that when he presented. The day passes, where the headache increases. By the evening it settles. It looks like that it may be an atramure, but there is a lot of difference. Okay, I think some other time we have to discuss all these differences, how the remedy differs from each. See, on 1/11/2018, we did a scanning again because we are worried. And that time, you know, the 18, they said the size has come down, but still all these things are persisting. Then what is the plan? The surgeon's advice is a good surgeon, I will tell you. Advice, if you could able to tolerate, you wait, we'll do it. Then we continued our medicines. Can you able to see the field vision on 9/8/2019? What happened? You are seeing it, no? Field vision, what happened? See, MRI brain, again they did it. Growth is there. The size has come down where it could able to fit into the mass wherever it is there. See, here the field vision, where earlier field vision you have seen, no? How much it was blocked? What is the field vision here? That you didn't get it, no? See, MRI brain, it is there, but the size has reduced. The patient is free from his suffering. Headache came down. That was the confidence when he got it. Not only the headache, His vision became normal. See, these are all the remedies which has been prescribed during treatment. It's an acute remedies, belladonna, bryonia, gelsemium, iris, noxomica, depending on the acute totality of the symptoms, whenever what is needed. And deep acting remedies like calcarea carb was his constitutional remedy. So interesting, meconium and thuja. See, now you can see the comparatively, I have taken in the one frame. 8/3/2016, what is the field of vision? And 9/8/2019. This credit should go to homeopathy, not for me. If you are happy, you can make a class. Otherwise, you can sleep all. Because where we could able to save the patient's surgery, neurosurgery is always risky. We don't know. During surgery, see that vestibular schwannoma case you have seen. And they have warned. They told also, we are not very sure when we are making a surgery, the patient may lose their eyes, hearing, as well as other sensations also. See, brain is a very sensitive organ, very sensitive organ. How we say the mind is more sensitive than the brain, but still brain is very sensitive and very difficult to manage that. See, this video will be played.
My name is Venkat Dasari. In 2016,
Is audible?
I had a vision problem. It started actually with a headache, severe headache and a shooting pain. Then I visited I thought it's an eye problem. I visited the ophthalmologist who checked and then he asked me to contact the Shraddha Super Speciality Hospital where they have conducted various tests for a day and they said that nothing with the eye and they asked me to see the physician. I went and visited Dr. Ramesh, the physician. He have suggested me a MRI and thyroid test, which MRI said that there is a outgrowth in my pituitary gland, which is obstructing my optical nerve. And thyroid test was clear. Then he asked me to visit the endocrinologist. I visited the endocrinologist at Apollo
Yes, in the
Hospital
endocrinologist also
in
in between.
Bangalore. But the endocrinologist said there's nothing wrong with my system, and he asked me to visit a neurosurgeon. Neurosurgeon, he suggested me, he looked at all my reports and he suggested me that I have to undergo a surgery, which would be of 6 hours, and that would, it is not the immediate need of the surgery, but they asked me to undergo the surgery. And he said it will be 6 hours surgery. Then I contacted my cousin who is a pulmonologist in Vizag. He talked to his friend who is in Demands. He asked me to go and visit him. So I visited the doctor neurosurgeon. He's a associate professor of neurology in Niman's, Dr. Nasing Rao. He looked at it and he asked me to undergo the vision field mapping test. So that test gave a picture saying that my periphery region has blurredness. But he asked me to, wait for some time and look at how it develops. So in between, I happened to be visiting my family doctor, Dr. Sripad Hegde. So I went with all my reports to Dr. Hegde, and he looked at all the reports and he said that it can be cured, and he said that he is doing a research on that, and he started giving me the medicine. So I had the vision problem. I was not able to read the content of small print with my glasses on my mobile. So after using Dr. Hegde's medicine for about 3 weeks, Sunday morning without glasses. I was, looking at my mobile, and I was quite surprised to see that I could able to read everything without glasses, and that has given me confidence. And I started visiting Dr. Hegde. In between, I also went and started. Visiting Dr. Narsingarao alternately, who also suggested not to undergo the surgery. And the afterwards, again the MRI was done, and MRI has shown the same result. Then Dr. Narsingh Rao has suggested me to go for a CT scan, and but there was, the result was the same. But so after using the homeo medicine for some time, in 2018 again, there was a CT scan done, and there was the my tumor was started decreasing. And again, in between, I have neglected because I regained my eyesight, and I was confident enough, so I neglected taking the medicine from Dr. Hegde. Then again there was a slight headache, so again I visited the doctor. Doctor asked me to continue the medicine. It was just a simple the pills, which I started continuing it. In 2019 February, I have done again the MRI, and the results were really spectacular. And the tumor started regressing. So this is, I have really gained the confidence, and I'm continuing to use the medicine. But now I'm completely relieved of the headache, and the my vision. So vision also now improved. It has got back to 6/6. Thank you.
See, this is the patient's explanation, because if you hear from him, then you get a more confidence that what the patient enjoyed or what he has suffered, what the troubles he has faced during the suffering. And it was so like that in the 19 and all, anyhow, the doctors were not doing surgery. The COVID effect was there, no? But before that only it had started. Even surgeon was surprised. He said, okay, whatever the medicine you are taking, anyhow, the tumor started regressing. Your vision became all right and you are free from headache. And we will see, we will wait. See, this is the answer what the surgeon gave. But in that way, he is lucky that they have not interfered. Just he has given some time to wait and see what best we could able to do in that way. See, these are all the things where we say that 40% of the brain tumor patients in the study used alternative therapies, including homeopathic remedies. This is the study done by the others also. Vitamin supplements and psychological therapy also sometimes may support for the treatment. List of reasons for using alternative treatments. The most commonly chosen response were to support conventional therapy to build up body resistance. And of those who used alternative treatments, 39% used homeopathy and 31% used other supplements. See, there is a need to set up a research program for finding the efficacy of homeopathic medicines against brain tumor and cancers. Because of late we see the cancer is one of the big threat for the medical fraternity. And what are all the scope and what is the best treatment we could be able to give for the patients in the initial phase, in the complicated phase, or as a supportive therapy. How we say that, you say the suppression or whatever the words you use, but we could able to give a better life for the patients how long he lives. And some homeopathic medicines have been proven experimentally and clinically. However, there is a wide range of medicines on which clinical data is not available. Homeopathic colleges with PG courses can take up such studies, especially where there is a lot of scope for these protocols to identify what are the best remedies can be given for the space occupying lesions like brain tumors. 15 patients diagnosed with this is a very interesting information for you. This is not mine. Okay, with intracranial tumors were treated with Ruta 6 and Calcarea for 6X. Of these 15 patients, 6 of the 7 glioma patients showed complete regression of tumors. This is one of the study, but somebody mentioned, and normal human blood lymphocytes B lymphoid cells and brain cancer cells treated with Ruta in vitro were examined for telomere dynamics, mitotic catastrophe, and apoptosis to understand the possible mechanism of cell killing using conventional and molecular cytogenetic techniques. These researchers proposed that Ruta in combination with Calcarea for 6H could be used for effective treatment of brain cancers and particularly glioma. You can try. But in my this thing where I have hardly used Ruta. In many other countries, homeopathy treatment of combination medicines. This also may be because we have to keep our eyes open for everything. We should not be too much restricted also. Even yesterday, the secretary of NCHG was telling, see, we could able to utilize the best opportunity. You give homeopathic medicine along with that, any other medicines could able to support, which could able to give a relief for the patient. Certainly, we have to accept it and we have to go with that. नहीं नहीं मैं होम्योपैथी दे रहा हूँ मैं कुछ का दूध कुछ नहीं देता हूँ पेशेंट मर जाएगा फिर होम्योपैथी आपने साथ में रखना पड़ेगा See, we have to see what is the latest changes and how the things are going. What changes are taking place according to the flow. We have to go with that. And this is all my best in the experience I have seen. These are all the remedies on series how it has helped in the treating the space occupying lesions of the brain. Belladonna, calcarea, conium, thuja, aconite, gelsemium, clonine, lachesis, and medorinum. Bryonia, kali iodide, sulfur, conium, phosphorus. You may differ, but this is experience what I have seen the results. Amyl nitrate, belladonna, gelsemium, melilotus, stramonium, belladonna, spigelia, lachesis, mercuriodate, bryonia, iris, calicar, glyco, calcarea, aconite, bryonia, natramur, sepia, calcarea, belladonna, cicuta, opium, conium, thuja, aconite, glonine, opium, ioscimus, stramonium, bryonia, sepia, opium, thuja, apomorphine, boretacarb, belladonna, hydrastis, kali iodide, plumbamate, belladonna, calcarea iodide, conium, mercuriodate rubrum. See how it will help even in your case. You can try or you can do your own. See other remedies like increased intracranial pressures, Hedera helix, Viscum album, Zincum met, double vision with severe headache, cyclamen, gelsemium, hyoscyamus, nitric acid, double vision with headache and vertigo, belladonna, oleander, onosmodium, plumbum iodide, tumor with convulsions, Oinate crocota, Cupromyceticum iodoform, tumor with hydrocephalus, Apis, Apocynon, Cyperpedium, Helleborus, Laburnum, Zincum brome, and Zincum met. See, the research done by Dr. Candace Pert were American brilliant molecular biologist who was a key figure in the discovery of the endorphin molecule, the body's natural forms of morphine. She is now widely regarded as the mother of a new field of science known as psychoneuroimmunology. See, this is how the latest studies they are conducting. She concludes that there is a communication between human mind and cells. The neuropeptides and immunopeptides are the messengers of this communication. The emotions experienced by human beings can directly impact the cells of human body, either causing disease or keeping the human cells in the state of health. Thus, through the research done by Dr. Candace Pert, the mind and body link is established on the basis of molecular research done in her laboratory. This has been done the long back by Hahnemann. Give me a big hand because this now they are explaining in a different heading. They are in a different heading they are explaining, but that has been done the day back. We homeopaths take all emotional, mental aspects, symptoms into consideration to individualize a patient. Even if a twin comes to us for treatment of a simple cold, the individuality of each of the twin, it may be different. For one twin, you may give aconite, another one you may give LM cepa. Thus, then we as a homeopathic physician capture the patient's minutest mental, emotional, spiritual details. We cover the disordered cell, organ, part of the body automatically. As the human cells, organs, parts in general, the physics is in synchronous with the mental or emotional or spiritual state of the individual. Once we arrive at the key details from the patient, we select a homeopathic remedy that is indicated for the same behavioral pattern as well as the same pathology that of the patient. A remedy selected on the patient's individuality cures the patient completely and the cure lasts longer even though the patient is exposed to the same trigger factor. Then homeopathic treatment is most beneficial in space occupying lesion. No doubt at all. Maybe in the initial stage, you could able to diagnose and start. then we could able to arrest the further growth of that. Or we have a scope for, that's why I said as an acute medicine or as a curative constitutional medicine, or to reduce the pain or discomfort of the patient, to reduce the tendency to regrowth of the tumor after surgery. Many times this we have seen these brain tumors are regrowing capacity. And however they do the classical surgeons, they conduct the surgery, they are also not very clear that some part of the tissue might have remained and it may grow again. This is what sometimes they reveal, sometimes they don't reveal, but that is fact. That's why their homeopathy has got a very potential role to take care. Then quality of life may be made more comfortable. That is only with the homeopaths we could able to give them a relief. Then in the aphorism 16, Hanuman said already, from this intubation truth that besides the totality of the symptoms, with consideration of the accompanying modalities, nothing can by means be discovered in disease wherewith they could express their need of, and it follows undeniably that the sum of all the symptoms and conditions in each individual case of disease must be the sole indication, the sole guide to direct us in the choice of a remedy. And here I am concluding my teaching. Very interestingly, I will tell you, I could able to share with you, of late, patients are suffering from what I will tell you, not disease. Because lack of love and affection in the society, from their parents, from their children, in the society. A doctor could able to give some sympathy, some counseling words, some comfortable, patient will survive comfortably and they will come back to you for follow-up. I will tell you. This is a very simple the method where you can do. Whatever they say, it may be a cancer, terminal stage. Give some comfortable word. No, we'll see. We could able to help you. See, these two words or sentences will give them some like, okay, there is some relief is there with this system or with this doctor. That itself will give some relief. Then the words, we don't know what will happen. That is lacking. Of late, I am seeing medical faculties going in or a medical practice is going in a different way. Thank you, sir, giving me an opportunity to share my few words. I don't know. I thought maybe in this conference we could able to make it a different one. There are hatke, sabhi se. That's why I have selected this, and these cases we could able to make it. Thank you, sir.
Thank you, sir, for sharing your anonymous clinical experiences with us and giving us valuable insights about such beautiful treated rare cases. I now invite Dr. Konkani, sir, to give the concluding remarks for both the sessions.
Good afternoon, all of you. It's indeed tough job to pass a concluding remarks on such a legendary speakers and physicians in the homeopathic fraternity. No doubt, the time is running and you all must be hungry, must be going or running to a catering section now. Presentation of Dr. B.D. Patel, sir, on PCOS and PCOD was really a testament for his experience in a homeopathic practice for more than 3 decades, 5 decades. I'm sorry. Sir has said that, and I think the cases which you all saw from 1998. So in 1990 till 1998, he must have sat and had an hold on the experience and the treatment. And definitely he had a confidence of treating all of them who have come for the help. But my dear friends, as a beginner, you have a lot of responsibility as PCOS is becoming a major problem in present days. And you find gynecologist or obstetrician in every lane of the cities. So under such circumstances, whenever such cases comes, most of the time the cases come to us only after trying some other gynecologist and obstetrician. When you want to take up the job, analyze, assess the case, go for simple investigations, basic investigation like ultrasonography, hormonal assessment, very important, and then decide what is your approach. Sir has given very beautiful tips. Rather than in PCOD and PCOS, the lifestyle modification play a vital role. Infertility is not only the problem with PCOS. What I feel and what my experience is, hirsutism, obesity, nearly more than 50% of going landing up with a diabetes, early initiation of diabetes in PCOS, and around 7 to 10% of those cases I have seen landing up with the endometrial cancer also. So those have to be kept in mind when you're dealing, and always never take a chance that giving a false assurance to the patients that I will treat, I will treat. Keep all those things in the mind. Take opinion of the specialist or other modern medicine gynecologist, and have a rapport with the gynecologist and obstetrician. Whenever they find it difficult cases to treat, you can get associated with and manage those cases. And those cases, as everybody is mentioning since yesterday, becomes a very good cases to have records and research to prove the evidence-based cures in homeopathic fraternity. So I appreciate Patel sir's humorous lecture, and very fortunate to have him. And your lectures are always enjoyed by the audience at all platforms. As far as the other legendary physician and academician, Dr. Sripad Hegde sir, you all know, has presented very nice cases of space occupying lesion, intracranial space occupying lesions. Again, as I mentioned, this field is very delicate, and sometimes if you dare without proper assessment of the case and take up the job, we all may play a very vital role in avoiding certain surgeries in some cases, but again subjected to assessment and analysis of the cases, because certain space occupying lesions, right from hematoma to any other tumors, are life threatening. So you need to assess, analyze, get the investigation done, try to assess the prognosis and the rapidity of the growth of the space occupying lesion. And sir was mainly dealing with ophthalmic, vision related tumors. So those tumors are mainly the tumors of occipital row, where the visual center is related, and the tumors where the optic nerve traverses to the orbit. So those things he dealt, and only because of his experience and confidence, he could take up those things. And some case he was showing that who had an hemianopia in the earlier scan, which has subjected, means cured, almost shown an improvement in the later scans. So these are all very good cases. I hope you all will take a lot of things for these from the deliberations of these legends, and try to inculcate them into a practice. But before that, be a cautious when you take up any job, or take the guidances from the elders in dealing such cases. Thank you very much, sir, for the wonderful presentations, and audience also for a patient listening.
Thank you,
Before
sir.
I conclude, let me express my sincere appreciation and heartiest congratulations to the team of KLE's Homeopathic Medical College and the university, Urchankar sir, and entire the team of Dr. Urchankar sir. Sir, you and me sit, plan and direct, but it is the team the faculty members, the students, they work day in and day out for organizing and executing such events successfully. Hats off to all the team of the KLE Homeopathic Medical College. I appreciate and look forward for such events in the coming days. Thank you.
Thank you, sir. I now request Dr. Kolkani sir and Dr. Srinivasulu sir to present a memento to Dr. B.D. Patel sir and Dr. Shripad Hegde sir. I request Dr. Urchankar sir to come on to the dais.
I request Dr. B.D. Patel sir, Dr. Shripad Hegde sir and Dr. Uchankar sir to present a memento to our chairman and co-chairman Dr. Konkani sir and Dr. Srinivasul sir. Thank you, sir, for doing the honors. We now break for the lunch break. We'll be back at 2:15 to 2:30 for a wonderful session on body language. We will be all enjoying the next session, so request the audience to please finish the lunch and come back for the next session. We all will be gathering together at 2:30. The session starts exactly at 2:30, so please be back after lunch at 2:30.
Well, friends, 1 minute we all wait for a wonderful memento from my side to Dr. Jessica. Yes, she needs a big guide here. From morning she's doing that. She got scared. अरे मुझे देखते लोग डरते हैं पता नहीं what happened
वही तो ढूंढना पड़ेगा.
Good afternoon to one and all present here. We now start with the afternoon session. We have an interesting session on body language, its use in clinical practice. For this session, I would like to invite the speaker, Dr. Shahala Nadaf, Chairman, Dr. Prabhu Kiran sir, and Co-Chairman, Dr. Girish Kulkarni sir, onto the stage.
I request Dr. Jessica to introduce the chairman, Dr. Prabhu Kiran sir, and Dr. Apurva to Dr. Groven to give a floral welcome to our speaker, chairman, and co-chairman.
It gives me an immense pleasure to introduce our chairman for the session, Dr. Prabhu Kiran sir. Sir is the principal of Father Muller Homeopathic Medical College, Mangalore. Sir has a professional experience of 32 years, teaching experience of 29 years. He has held many eminent posts, appointed faculty trainer CBDC by National Commission of Homeopathy, served as Vice Principal of Father Muller Medical College from the year 2014 to 2020, Coordinator Internal Quality Assurance Cell, Father Muller Homeopathic College, Mangalore, Chairman Board of Studies, Undergraduate, RGHS, Bangalore, Founder President of Karnataka State Chapter of Indian Homeopathic Medical Association, presented and published papers in national and international seminars and forums, founder editor of Homeo Era Monthly Journal, research projects undertaken, efficacy of toxicodone in relation with hyaluronic acid and its application on primary osteoarthritis, funded by RGHS Health Science Bangalore. We are glad to have you here, sir, with us.
It brings me an immense pleasure to introduce our co-chairman, Dr. Girish Kulkarni sir. Sir is a principal and professor and HOD in Department of Repertory at SB Shirkori Homeopathic Medical College and Hospital, Sankeshwar. Sir has 23 years of teaching experience. Sir has completed his MD in FCHM from MUHS University. Sir is an examiner and paper setter for RGHS Bangalore, former BOS member of RGHS Bangalore, examiner for Goa University, and academic council member of RGHS Bangalore. Sir has a lot of contribution in administrative assignments and has attended multiple CMEs, participated at multiple CME seminars, national and international conferences. We are honored to have you, sir, with us.
I now request Dr. Girish Kulkarni, sir, to introduce the session to us.
Good afternoon, everybody. It is my immense pleasure to give the introduction of Dr. Ajit Kulkarni, the MD homeopath and director of Homeopathic Research Institute, Pune, a veteran homeopathic and academician and a framed international teacher. He is a co-examiner, co-author, and absolute homeopathic veteran medica, author of laws similars in medical science, author of homeopathic physiology. So instead of him, he has not come because of his not feeling well. Instead of him, Dr. Salanadav will present his seminar. So Dr. Salanadav is also an MD homeopath. She's also a co-examiner and a mentor of Batra's homeopathy. Madam, I present you and stage is yours. Thank you.
A very good afternoon to everybody. I'm come with a very daunting task today because I'm going to present a very beautiful, what you call, a session of body language. And like Dr. Girish just mentioned, Dr. Ajit Kulkarni, for some medical emergencies, is not able to make it. It is a colossal task for me because it's a huge topic, and the author, Dr. Ajit Kulkarni, has done a tremendous work in this particular, what you call, topic. So basically, just to give you all a brief introduction about body language. See, body language, basically, the term itself implies that it is a part of the communication we have between two people, isn't it? We as physicians, this I would like to give more reference to the student community, not to my senior teachers and this thing, because uh, it has always been a very important, what you call, topic. And I really a bit taken back today to talk about this topic because it's told by a great teacher and I have all great teachers in front of me. But I'm sure I'm just going to just ignite a bit of this topic and this book to you people, so that right from the first year to the final year, we are always doing our case taking, isn't it? The communication between the physician and the student takes, or the physician and the patient takes place from the first year itself. Okay. Second year, when you enter clinical classes, you actually come in what you call face to face with your patients. So what is this communication skill? Books, when you study organon, okay, we have a term called as case taking. I would just like to add another term to it, which is not my own term. When you study the Dhavle's, what you call synopsis volumes or symposium volumes, they don't call it as case taking, they call it as case receiving, which is more apt. Because when you take a case, it's just a didactic, like what you conversation between you and the patient. But when we take receiving, we are actually receiving the patient in the entirety. Okay, it's not, most of the times we keep on bombarding in you when we teach you that give importance to mentals, give importance to what you call physical examination. But somewhere down the line, we miss the point to inform you or to inculcate in you the art of understanding or studying the what you call body language of a patient. Okay, though if you refer to each and every drug of a materia medica, there is something called as a body language. For example, you have a calcarea carp patient walking. Please refer to Farrington's initial what you call preface when he talks about looking at the patient and identifying the drug. That is not a prejudice. It is basically, he says, it's an intuition which comes after lots of experience. But to get this experience in our later years and to understand the body language of patient, we better start it from right from the second year onwards. So that is why I said I would just like to ignite a bit and try to make you understand. Yes, mental symptoms, evaluation of mental symptoms, scans analysis, everything I'm sure, because we have it as a part of our exam question answers in a syllabus, you will do it very well. But studying body language becomes a task which you have to take by yourself, and that is going to make you a good physician, a good receiving physician, and a average physician. I would not say a bad. We all homeopaths are going to be really very good physicians, but an average and a very good one. Okay, that's the difference when you understand body language, right? So apart from what we call today's lecture, if you go through Sir's book, that is Body Language, it is also translated in Marathi now. In this particular book, you will find various things, right from how you approach a patient, okay, and in end he has talked about the rubrics of different remedies and the what you call case presentations, what is done. So it will be a very difficult task for me to put up everything, so I'm just giving you what things has to be done, what a physician has to reveal himself when he's into a conversation with the patient. So the introduction of Dr. Ajit Kulkarni. So what is an interview? Okay, it could be an interview in our what you call parlance as a homeopath. It is basically case taking. So we have the doctor and the physician, or you can just say in a business language, it is a client and a salesperson. So most people don't really understand the incredible impact and importance of body language. Says Karen Leland. He is one of the professor of kinesics. Kinesics is a branch in communication. So much super specialization. Now in body language also, there is one branch called as kinesics, where they only study the movements and the gestures which a person or individual presents. Okay. So Care Leland is one of the authors of that. It's mostly because they are not taught it in the colleges. However, it's not too late to learn. So that is what I'm saying. I think we should, this particular audience should not be too late to learn, especially the second years, because you need to understand Hahnemann has told mind, body and soul. Okay. Morning we had such beautiful sessions where even Dr. Patel was telling us about how soul things are manifested. He was expressing it through various what you call Veda scriptures. So the very point is that as homeopaths, we need to understand that we try to run after the mind, but the mind is the one which instigates the body. Okay. So whatever you are expressing in the mind, it comes in the forms of your language. Right now, I'm what you call moving my hands. This gesture also will have some importance. Okay. When a patient walks into a clinic, for example, there's a case of Calcarea cup. How will a Calcarea cup patient's body language be? Okay. Apart from his physical appearance, that he may be fat, fair, flabby, not necessarily. He will walk into a clinic very slowly. Okay. And most of people do have arthritis or some musculoskeletal problems. So he will slowly pull the chair and sit down. By this very gesture, you come to know that he could be a Calcarea patient. Once you analyze your entire case, you can always correlate his body language. You have a Silesia child. How will a Silesia child be? He will just come and sit in front of you and be very timid and just looking at you. Okay. But if you see the other aspects of body language, he's going to be a very accurate child. He will have a typical posture. He will sit straight, but he will have that slight bend of his shoulders and he will look into your eyes on and off. He will not have a direct contact with you. So these are few cues that we need to understand, and that happens only if you study body language properly, and that you did not study a different book or subject for that, though we have a very good literature here now. It is also in your materia medica, all this what you call particular things are there. You only have to correlate with your totality of symptoms. So like for example, temperaments, when we study temperaments, now a very good work done by, it's very proud feeling for all us of homeopaths, because two Indian homeopaths, Dr. Parinaz Umranwala and Dr. Ajit Kulkarni sir, have forayed into an entirely, what you call not entirely different, I would say, have forayed more deeply into understanding what you call case receiving, isn't it? Because when you understand temperaments, we just know the definition. We just know the definition of body language. Because when I take psychology classes, I just tell them what is body language. But we don't try to what you call take special clinical classes for you. But I think that particular thing has started now, and we need to understand that these two, what you call temperament and body language, are a part of case receiving or case taking, isn't it? If you understand these two things very well, your analysis, the final analysis of a remedy becomes more accurate. It comes into totality of symptom. We cannot exclude it from the physical symptoms, what I mean to say. Because generally what idea a second year student will have at this moment, or even a final year for that moment, when you talk about physical symptoms, you only think more about the physical generals, because that gives the totality of the patient. But please understand, in physical generals, you have to go into this mode of gestures and understanding how the look thinks. Now, body language can be misinterpreted even by a seasoned homeopath, because it is illusionary in the sense that sometimes the patient may be, because of his disease condition, may be presenting to you in a certain form. Okay, maybe it could be his environmental background, it could be his educational background. So many things are there. So you as a physician, when we sit in the chair, we need to understand all these aspects, and for that you have to be empathetic. So the main success of a physician, he may have a very good clinic, he may have the best of knowledge and skills, but if he does not know how to present the body language, it becomes a little awkward, for especially in a homeopathic scenario, homeopathic case taking scenario. So success in practice depends upon the utilization of the tool of the body language. Okay, the here I would say, instead of a client, the patient and the doctor, the communication involves a two-way exchange of non-verbal information. Okay, when you say, suddenly you don't just start say hello. When you meet, the first thing when you get up or the patient enters your cabin, you're just going to have an eye-to-eye contact, and there the conversation actually starts. Okay, the non-verbal conversation, what we call. The physician who reciprocates with non-verbal cues of patient makes an impact on a patient to a greater degree than the physician who deals with the patient in a very mechanical way. Okay, looking down his paper, the first patient has gone and he's still looking down. Okay, please come in. So that looks very mechanical. Okay, but he's just waiting, looking at the door where the patient is entering, gives a slight smile that goes a long way in making the patient feel comfortable. Because at the end of the day, for a good homeopathic case receiving or case taking, the rapport between the patient and physician is of prime importance. It's not about how you are going to diagnose the case, at least in the first interview, right? So the physician's body language and facial expressions also influence the reaction of the patient in a considerable way. So body language is like an autobiography in motion, it is said. Okay, it is broadcasting station that works round the clock and keeps on relaying signals to the outer world uninterruptedly, whole time. Whether you're in the kitchen, you're in your office, you're in a boardroom, all the time our body is expressing some of the other things which we are unconsciously aware of. Okay, maybe even the opposite person is unconscious about it. So physician should form a psychic map of a patient to ascertain his mood and match the frequency and tempo of his responsive tone with it. He should be actively sensitive to each and every gesture of the patient. It's very important. Okay. A simple gesture. He may walk into your cabin, you may be having an AC, and he will just try to, what you call, go into a typical position, fold his arms. So that itself is a cue that he is feeling cold. Okay, very simple things may sound silly, but are very important for an eye. Okay, the problem with communication is illusion that it has occurred. Like I just told you, if the patient is sick and he may be presenting with certain body language, so that could be an illusion that we have to be careful. We cannot jump to a conclusion that the patient is very awkward. It could be a psychiatric case who will be presenting with depression, may have a certain form of body language. So again, we need to identify between the proper body language and what the patient is manifesting because of the problem. Okay? People don't care of how much you know about your subject as a physician, maybe initially at least, but they will just definitely feel very good how you take care about them, how empathetic you are, with what smile, with what body language do you welcome the patient into your cabin. So like they always say, first impressions are indelible. I mean, they cannot be marked out. So simply try to be open. To get others to open up, you must first open up to them. Keep a good attitude. Be retrospective and aware of your own body posture. Even that is important, because see, the patient is a sick person. He is going to come in a different avatar to you when he comes in front of you. Okay. But as a physician, I think it is our prime duty that you yourself be very presentable first. It may not be in the form of a suit and boot, okay, but at least by our gestures and at least by attitude that we take in the patient and try to make him feel that he's important to you at that moment, because nothing else matters when the patient is in front of us. Yeah, some things which even in the book it has been mentioned. These are very general things, but somehow in our busy practices we tend to forget about these things. Always see that you take your sunglasses off. Okay, I would not say the other specs. Move closer, but not too close. Now this, we will talk a little elaborately in the next slide. lean a little bit forward, because leaning forward gives you gives the patient an understanding that we are interested in you. If I talk from far, you will not like it. See, I was standing behind the podium. I was not feeling comfortable. I was feeling I was not connecting to you people. I'm a little this side. I'm a bit comfortable now. Okay. And even you can see me with the entire thing. So you also will feel comfortable. So that is how it should go. Uncrossed legs are very important, because crossed legs and crossed, what you call, folding your hands at this is type of gesture in the kinesics language, it means that you are trying to avoid that person or the situation. Okay, you are going into a sort of escapism. So this is one of the cues that I'm trying to tell. There are many more when you study the entire kinesics. Okay, so that should be avoided by the physician. Repeated, what you call, glances at one particular thing. See, the moment the patient enters, he may be having certain gestures. So don't make the patient conscious by keep on looking at that, glancing at that particular gesture, because he may get conscious and suddenly change it, and you may miss out the opportunity of understanding his body language cues. Okay. Then open lip smiling. Okay, does not mean you have to giggle, but it does help when you have a broader smile, not like Madhuri Dixit's, maybe at least a normal smile, which you're trying to tell the patient, yes, I'm with you. Okay. So open hands with palms as visible instead of close fisted things, which I just mentioned. Small upper or inward smile. Then erect body stance. Hands should be open. Okay, they should not be always curved like this or just leaning like in this. You lean forward, but with your arms open. And especially when you're going to examine the patient, the patient is lying, you're taking the blood pressure. So there's no point of standing like this. That is okay. As a student, we do all that. All of us have done that, because teacher is there, you are sort of intrigued. But when you're in the front of patient, you need to be open-handed. You need to help the patient to climb this thing if he's an old person. So this small body language on the physician side will make you more appropriate with the patient, right? So appearance of a patient, of a doctor, in fact, not a patient. Lack of concern about the way you look makes a little bit impact. Of course, you should be in very comfortable and good clothes, but try being unshaven, smelly. A typical sulfur doctor would not make much of an impact, at least in today's scenario, where you have to be, see, like morning also. Some of our seniors have mentioned to us today, in a joking way, of course. Let us take it with a pun, that medical field has become bit like a business. Okay, if not totally. So you have to run the business. There's no other goal. It's your bread, butter, and probably you'll earn jam in the coming days. So these things are important, that you present yourself way, so that your clinic, you as a doctor will be well known for your practice, but also the way you look is important. So neat, clean, and iron dress appropriate profession for doctor projects an elegant image. Most of the doctors do wear their aprons, which is definitely a good, what you call, culture of keeping a clinic. In our hospitals, we wear it. So that all makes an impact. So the same thing, never wear anything sloppy. It's basically more for the females. Maybe a little less makeup and other things would be more appropriate. So we don't want to be a boring doctor. I'm sure nobody of us are boring doctors. Especially we homeopaths are very boisterous, very vivacious people. Okay, because for us it's I would not I would say that I would like to say that if an allopath is practicing, after I think 6 months to 1 year or max 2 years, they start getting bored of their practice. That is what my friends do tell me who are allopaths. Because every case that comes, they have to prescribe a certain set of antibiotics and keep on repeating the same thing for everybody. But you as an homeopath, when you sit on your chair, it is amazing. Every case that walks into a clinic, you are actually entering into the life of a different individual, and you are experiencing very different moods and affections, okay, and very different life spaces. And that makes you very, what you call, understanding. It's a very lively session. You can never get bored of a homeopathic practice, basically because today I may give lycopodium to this patient, the same patient with diabetes may come, but I may give argentum nitricum. That is so beautiful. So we don't have the, what you call, tendency to get bored. And so for that sake, I think we are blessed to be in a system of medicine where the connectivity with the human soul is more important than his body. Okay. So the biggest single problem, George Bernard Shaw says, is communication is an illusion, is an illusion that takes place in communication, and that needs to be avoided. So poor posture can lead to unfair judgments. Poor posture, again, by the physician is seen as a closed body language. Do not make rash judgment basically of this thing. These things I've just spoken about. Do not cross your arms in front of the patient. Do not cross your legs or arms basically, because it shows a blockage in the communication. Face-to-face interaction is very what you call important. I understand that we as homeopaths, whether you use your laptop or you use a pen and paper, we need to jot down a lot of things, right? But instead of that, you can still practice having a on and off glance and a eye to eye connect with your patient, so that you understand things more in the entirety. Because when you have to look into the soul of a patient, that is what our prescription demands. You need to look into the eyes, because the eyes are again the soul of the patient, isn't it? And stand evenly on both the feet, so that you don't be standing in a very tilted manner, and all will not give a very good impression to the patient, and he may feel that the doctor is not interested. He's just standing there and keeping to stay on one hand on the table and standing at the side, may not give a very good impression. That does not listen. So solar technique is one of the things which is again put up in the kinesics of what you call body language. So it means solar basically means sit squarely in relation to the patient, open position, lean slightly towards the patient, eye contact is important, and have a very relaxed stance. Yeah, now this is very important. The tactile communication, you should take it with a little of understanding in this. Of course, as a physician, when whatever your age, and whatever is the age of the patient, you are more on the maternal aspect. Okay, so if the patient is crying, it would not be wrong in a certain way if I just pat on his shoulder. Okay, as a physician, because you're entitled to do that. You may just give a pat on the head of the small child, okay, or just pat on the cheek, but then with a word of caution, because we must know the culture of a patient too, especially in an Indian culture. Certain communities we are not allowed to what you call touch, especially if it's of the opposite sex. For example, the doctor is a male and he's examining a female patient, he can't just go and give a hug. It would sound very inappropriate. But if you see the foreign what you call patients on the clientele, what we have, they do not mind it, because culturally they're different from us. Okay, so those things have to be taken into consideration. But just having a little tactile what you call a pro to your case would make a lot of difference. The patient will feel a little more what you call, the doctor is concerned about me. Okay, that is generally when we go to examine the patient, when we check the pulse and all. The great method would be like what the British people have a technique of doing a clinical examination, the British doctors. So it's very much taught to them that before every step that you take, even if you're going to touch the wrist of the patient, you're supposed to explain to the patient that I'm going to check your pulse rate now. I'll be putting 3 fingers. It may sound a bit elaborate, but since we are consultants, I think we better start doing it, because we don't take a case taking in rush, so we don't need to examine. If you follow the protocol, it will help go a long way. Okay, even if you have to check the eyes, you need to explain to the patient what I'm going to do and then do it. And in today's scenario, it plays a very important role, because things can get a bit messy if it goes a little wrong way. Okay, or if the patient takes it in a wrong way. So touch can be a risky proportion. You must be cautious, and if your selection or even timing is work, so sir has put up in the slide, perhaps you may receive a slap too. Okay. Yeah, this is very important. The clutter that you have in your physical space, that is on the table between you and your patients. The patients will bring a set of what you call files with him. Okay, you have your own things, especially after COVID. We have a mask, we have a stethoscope, all scattered. The space will looks cluttered, and that they say is again a very small but very important aspect of having a bad communication because it spoils the space between you and your patient. Okay, to the extent that even if the AC is too much or the fan is blowing on the face of you and your patient, also can cause a little difficulty in communicating well or in understanding the body language again. So facial expression should be like this. The combination of openness, smile, sincerity works a long way. We would not say that so when patient walks to your clinic, he's a sick person. Naturally, he's not going to come laughing all the way. But a little smile, a little encouragement from your side goes a long way. Because even if you remember, now also if I see my teacher nodding or what you call smiling, I always get the confidence, yes, I'm going the right way. That gives a little edge. It happens same with the patient. He wants to reveal something intimate, he wants to reveal something very sad about him, or even the good aspect of it, but your expression matters a lot. Yeah, then comes the main important aspect is the voice, the vocal conversation. So keep the tone very polite to your patient because most of patients may be uneducated. They may not be having education about the particular thing they're facing. They may be a little dragged. They may be a little too fast. But as a physician, we need to maintain our composure. So arrogantly, if you just tell, oh, that much you don't know, didn't you see the Google and come? That will not make a very good impact on the patient and it should be avoided. Be expressive, but not overdoing it. Be open, but not to the point of being contrived and affected. Okay. Contrived is not being forcefully being able to manage the situation. Do not fidget, scratch, twitch, wiggle, or squirm in front of a patient because we understand when you are in your OPD, you have to see at times 15, 20 patients maybe. And it becomes because even as a physician, you are a human being at the end of the day. So just see that these things are taken to consideration because every case is a new case. Okay. It also means even professionally. It's just not that Hahnemann is to every case new case for the disease aspect itself, but also as an individual, every case new case, and we have to receive it in a different way. Yeah, this is a good thing. I think most of whether it's a doctor or this thing, the staffing thing is a very common aspect. We see many what you call individuals, especially if you're getting late or you're waiting for your next call or your receptionist has not come and taken out this patient, you start tapping at this thing unconsciously. This is a very common phenomena which occurs, which needs to be looked into and avoided. Yeah, it's a responsibility of the physician to respect the territory of the patient, whether it is in case receiving as well as in a physical form also. Generally, the personal space extends about to the distance of an arm. Okay, the table should be so long enough that at least this much arm should be there because nowadays, of course, within the metros and other things, we all have small clinics. Not in Belgaum, we have the luxury of having a lot of space. Okay, but it doesn't happen so in the metros that we see. So maybe at least a hand distance should be there between the patient and yourself. Okay. So this is a common or this is a standard thing. It's not about only clinic in general. In the book of kinesics, again, this is put up. So 12 feet, this zone is for the public. When you're in the public space, at least 12 feet distance should be there between two individuals. 4 feet for social interactions such as business settings, when you're in a boardroom meeting or when you are even in a clinic for that matter. At least 4 feet, 18 inches reserved for friends and family, 6 inches for close relationships, okay? Maybe a mother and child, a husband and wife, 0 to 6 inches, very intimate relationships, okay? So this is just a general space. So focus on the position as a patient walks into a clinic. If you read again the preface of Farrington, he says, nowadays I don't have to even talk to the patient. The moment a sulfur patient enters my chamber, I come to know he's a sulfur patient because he's having stooped shoulders. He will walk in a particular way. His attire will be in a particular way. And that is how I identify it as a sulfur patient. So that is exactly what a homeopath in the long run has to learn. As a student, especially we started during the studentship, we maybe in the coming years we will be able to master this particular technique like what our stalwarts have mentioned in the textbooks. Okay. So if you're just The domineering, superiority, authority, and confident and self-righteous things take place if you focus your head too high and not look with an eye contact. Okay. The picture itself is very depictive: submissive, yielding, inferior, withdrawing, meekness, shyness. Okay, this you can see in most of our cases of calcarea carb, cilicia, sometimes even natribute for that matter. But natribute does not have a very bent attitude. So it's not what you say, but how you say is very important. Okay, these are again a communication skill. The pitch is important, the way you talk to the patient, the speed is important, the loudness and the tone. All these things matter when you talk to your patient. So communicate with power, have a stance, have a positioning, walk, sitting, handshake. All these are a form. These tricks cannot be learned or read from a book. They have to be practiced, and it takes some time for each of us. At a very younger phase, if we start understanding these concepts clearly and not think that is just as a attitude thing, it's better for us, so that in future it comes very naturally to us. By the time you finish your internship, it should be a very natural stance that you do all these things when you receive your case. Apart from doing your case taking very well, that you learn from your second year to fourth year, you'll be bombarded with repertorization, with evaluation, with analysis, and how you take care of them. But these things have to be learned, and this polishes us further as a homeopath. So the power of confidence, a strong body will boost confidence. You can just go through resting well. Again, I'm repeating the same thing, will help improve your self-esteem. An open posture, speak in a confident tone to increase your feelings. So body language and homeopathy by Dr. Ajit Kulkarni. So this is Sir's number. You all can take a snapshot if you're interested in purchasing this particular book. And the same book, even in Marathi, it has been translated. It's a wonderful book. I have not, so don't misinterpret mine is just an introduction today, because unfortunately Sir couldn't make it. Otherwise today we would have a blast of the lecture, because he is definitely a teacher of teachers, isn't it? So thank you.
Thank you, Madam, for the wonderful presentation. I request our Chairman, Dr. Prabhukiran Sir, to present the concluding remarks.
Thank you, Dr. Mullah, for, I must say, a very unique presentation. Dr. Ajit Kulkarni's absence, in his absence, Madam narrated his presentation. At the same time, she has also provided her own perspective so that we could understand the concept of body language. All of you would agree with me that to understand the patient and to become an unprejudiced observer, body language will go in a great way. As she said, the part of case receiving is extremely important, and today the presentation helped us to be first, how do we prepare ourselves to receive the patient and understand the patient's issues and receive the patient in totality. Thank you, madam, for the presentation, and I congratulate the KLE Homeopathic Medical College for a successful organization, to the principal, Dr. Woodchankar sir, and the team KLE. And at the same time, I also thank them for giving me this opportunity.
Thank you, sir. I request Dr. Prabhukiran sir and Dr. Girish Kulkarni sir to present a memento to Dr. Shahala Nadaf ma'am. Thank you, sir. I also request Dr. Shahala Nadaf ma'am to present a memento to Dr. Prabhukiran sir and Dr. Girish Kulkarni sir. Thank you, sir and ma'am. We shall now begin with our valedictory function in a while. Give us 5 minutes. Kindly be seated. Ladies and gentlemen, esteemed guests, and dear delegates, we welcome you all for the valedictory function of National Conference 2024 Homeo Healing Voyage, a journey towards excellence.
I request the dignitaries to please come on the dais. Prayer is the key that unlocks all the storehouses of God's infinite grace and power. It's my pleasure to invite our multi-talented student to invoke God's presence with her melodious voice.
दैवताय गणाध्यक्षाय धीमहि गुणशरीराय गुणमण्डिताय गुणेशानाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि गानचतुराय गानप्राणाय गानान्तरात्मने गानोत्सुकाय गानमत्ताय गानोत्सुकमनसे गुरुपूजिताय गुरुदैवताय गुरुकुलस्थायिने गुरुविक्रमाय गुह्यप्रवराय गुरवे गुणगुरवे गुरुदैत्यबलक्षेत्रे गुरुधर्मसदाराध्याय गुरुपुत्रपरित्राते गुरुपाखण्डखण्डकाय गीतसाराय गीततत्त्वाय गीतगोत्राय धीमहि गूढगुल्फाय गन्धमत्ताय भोजयकराय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि
Thank you, Ms. Devyani, for invoking God's presence with your melodious voice.
Flowers are a proud assertion that a ray of beauty outvalues all the utilities in the world. I request Dr. M.A. Urchankar sir to present a floral welcome to Dr. Ganachari sir. I request Dr. Swarupa ma'am to present a floral welcome to Dr. Shripad Hegde sir. I request Dr. Shruti to present a floral welcome to Dr. M.A. Urchankar sir. I request Dr. Chetan to present a floral welcome to Dr. Swarupa ma'am.
I now invite Dr. Shilpa Patil Madam to introduce our esteemed chief guest for this auspicious occasion, Dr. M.S. Ganachari Sir, Registrar, Kahir.
A very good evening, respected dignitaries on the dais and off the dais, and one and all present here. Myself, Dr. Shilpa Patil, Associate Professor, Department of Homeopathic Materia Medica, KLE Homeopathic Medical College. It's a moment of pride for me to introduce our chief guest, Dr. M.S. Ganachari Sir, on today's valedictory function of National Homeopathic Conference 2024 Homeo Healing Voyage. Dr. M.S. Ganachari Sir is presently designated as Registrar, Kahir University. Sir is qualified as M.Pharm and PhD in Pharmacology. Sir completed his B.Pharm at Gulbarga University in 1919, M.Pharm in Pharmacology at Karnataka University in 1992, and PhD in Pharmacy at KLE University in 2011. He has a teaching experience of 30 years in UG and PG, and Sir has received many prestigious awards. Few among them are Best Teacher Award in 2010 by KLE University, Belagavi, Best Paper published in Indian Journal of Pharmacy Practice in 2011 by APTI. He has about 90 papers published in international and national journals and has 996 citations. He has presented 33 papers in international and national conferences and workshops. Sir is a resource person and has delivered more than 100 guest lectures. He has actively organized more than 50 workshops and conferences in various capacities. Sir has guided more than 66 M.Pharm dissertations and he is guiding 7 PhD students. With this brief introduction, I once again welcome Dr. M.S. Ganachari Sir, chief guest of today's valedictory function. Thank you one and all.
Thank you, Dr. Shilpa.
The Homeo Healing Voyage, a journey towards excellence, National Homeopathic Conference organized by KLE Homeopathic Medical College in association with KQHDA Bangalore was an extensive intellectual learning experience for all of us in the last 2 days, where wonderful insights were presented on the theme Empowering Wellness for Non-Communicable Diseases. I now invite Dr. Swarupa Patil Madam, in charge principal, KLE HMC, to present the report of the conference.
Good afternoon, one and all. Respected dignitaries on the dais, esteemed guests, and dear delegates. As she has already said, the National Homeopathic Conference, Homeo Healing Voyage 2024, was organized by KLE Homeopathic Medical College in association with Karnataka Qualified Homeopathic Doctors Association, Bangalore. The plans for it has begun almost 6 to 7 months back, and we were expecting that everything will go according to our plans. But there were so many changes, even till the last moment, and there were some stress moments where we had to literally say, all is well, and indeed, all is well that ends well. So now I would like to present the report before you. The number of delegates we had are 895. They are from 11 states. And this was arranged. And the conference is arranged in 2 halls. This is the one that is a 600-seater hall. And there is another hall which is a 300-seater. And the ID section of our university has helped us in telecasting the whole proceedings of this conference live, not only in the 3-seater hall, but also on YouTube and Facebook. So you can go through YouTube, Facebook from anywhere and you will be able to see the sessions here. The number of colleges which are participating in this conference is more than 25 from across the country. And we had highest number of student delegates from Bhartesh Homeopathic Medical College, Enepoya Medical College, Homeopathic Medical College, Shirkoi Homeopathic Medical College, and Bharati Vidyapet. I thank you all. The number of faculties present participating here is 66, and the number of practitioners, including those from Karnataka Qualified Homeopathic Doctors Association, was 36. So along with the scientific sessions, the simultaneous short paper presentations were held in 5 different sessions, and that was held in the anatomy hall of JNMC. And the number of these paper presentations were 48, and that of posters were 23. Now, to make this conference a success, a lot of hard work has been put up by the members of the organizing committee of KLE Homeopathic Medical College and also from the KQHDA. And this, our organizing committee is headed by none other than Dr. Amy Uchankar, sir, Director Administration of KLE Homeopathic Medical College. The various subcommittees which were formed consisted not only of the teaching faculty, but also the office staff and the non-teaching staff of our college. And they have worked relentlessly towards making this conference a reality. The role of KQHTA has been like that of an elder brother. I had said that earlier also, guiding and encouraging and supporting us at every step. We have eminent speakers from different parts of the country and also from NCH, who not only enriched us with their homeopathic experiences through their sessions, but also about case recordings as per the NCH norms. The chairpersons and the co-chairpersons for these sessions were respected principals of various homeopathic colleges and also the patron, president, and senior members of Karnataka Qualified Homeopathic Doctors Association. The 48 short paper presentations were judged for the best 2 in PhD and faculty and UG and PG category by judges from different colleges. The posters too were judged in 2 categories, that is UG and PG, and the best 2 were selected from each category, the results for which will be announced soon. The judges for the posters and paper presentations were Dr. Avinash Mehtre, Dr. Shaila Uchankar, ma'am, Dr. N. Madan, Dr. Shiv Prasad, Dr. Kadri, Dr. Anand Hosur, Dr. Milind Kulkarni, Dr. Itki, Dr. Nagaraj Havrad, Dr. Lingaraj Magdum, and Dr. Kiran Patil. I'm sincerely thankful to all of you, sirs and madam. I would like to also acknowledge that the food which we have enjoyed over the last 2 days was catered by Panchami caterers. And I also acknowledge the press and the media for covering our conference in various newspapers of different languages. And finally, the cultural program which entertained us yesterday evening was brought to us by the faculty and students of KLE Homeopathic Medical College. With this, I end my report. Thank you.
Thank you, ma'am. Winners are not the people who never fail, but they are the people who never quit. We now have reached a momentous part of our event where we have the honor of presenting certificates to recognize the hard work and dedication of our participants. Please join me in welcoming Dr. M.S. Ganachari, Sir, Registrar Kaher, who will be presenting the certificate to our deserving recipients. Let us applaud their achievements and celebrate their significant milestones together. I invite Dr. Chetan Kamble, Sir, Associate Professor, Department of Repertory, and Organizing Secretary of Homeo Healing Voyage, to announce the winners of the presentation.
Good afternoon, all. Madam has mentioned the name of Arvaz College, which we have more than 90 delegates. I thank Arvaz College as well as all the college where we have delegates. Thank you very much. I feel honored to announce the name of the winners of the paper and poster presentations. I request today's chief guest, Dr. M.S. Kanachari sir, Register Kahir, to present prizes to the winners. First, we go with the poster presentation, category UG. The first place goes to Miss Janvi Margale, Hausabai Medical College, Kolhapur. The second place secured by Miss Sana Ansari, Hausabai Homeopathic Medical College, Kolhapur. Poster presentation, category PG. First place secured by Dr. Shilpa R, Father Muller Homeopathic Medical College, Mangalore. Second place goes to Dr. Shreya Yan, Bharati Vidyapit Homeopathic Medical College, Pune. Moving on to the winners of scientific paper presentation, category UG and PG. First place goes to Dr. Hanmant Degikar, PG, Father Muller Homeopathic Medical College, Mangalore. The second place secured by Miss Ankita Karnik, UG, Father Muller Homeopathic Medical College, Mangalore. The prize winners for scientific paper presentation under the category of PhD and faculty. First place secured by Dr. Ashwin Kulkarni, Hausabai Homeopathic Medical College, Kolhapur. The second place goes to Dr. Rajiv Payas, Arihant Homeopathic Medical College, Gujarat. We would like to appreciate the presence of the delegates from different colleges who witnessed us with their presence by offering a token of appreciation. I request any faculty member from respected colleges can come on dais and take the memento. I'll call the name one by one. Bhardesh Homeopathic Medical College, Belagavi. Any faculty member can come on the dais and take the memento. AM Sheikh Homeopathic Medical College, Belagavi. Sri Shiv Basavajyoti Homeopathic Medical College, Belagavi. SB Shirkodi Homeopathic Medical College, Sankeshwar. Alvas Homeopathic Medical College, Moodbidri, Mangalore. Yanapoya Homeopathic Medical College, Mangalore. Father Muller Homeopathic Medical College, Daralkatte, Mangalore. Bharati Vidyapith Homeopathic Medical College, Pune. Late Mrs. Hausabai Homeopathic Medical College, Kolhapur. We would like to extend our greetings to our sponsors for their generous support. I request any representative can come on the dais and collect the memento. SBL Private Limited, Baxan Homeopathy, Dr. Vilmar Shobe, Vizal, IBPF Publications, Padma Homeo Pharmacy, Prasad Homeo Pharmacy, Homepath Software, I feel happy the first 5 toppers from 1st to 4th year BHMS of KLHMC will be receiving a free mobile software Homepath as a token of appreciation, for which I thank Dr. Jawar Shah, MD of Homepath. At UG level, we have kept on competition for both best logo, and the winners are Miss Akshata and Miss Pratyusha. Thank you, sir. Thank you, one and all.
Thank you, all the dignitaries and Dr. Chetan.
As we conclude this enriching conference, we invite two delegates to share their reflections on the insightful discussions and experiences gained throughout our journey. Your perspectives are valuable in capturing the essence of our time together. I invite Dr. Kavita Bugade, Assistant Professor, Department of Pathology, Bhartesh Homeopathic Medical College, Belagavi, to please come forward and share your thoughts.
A very good evening to all. Myself, Dr. Kavita Bugade, Assistant Professor, Department of Pathology from Bhartesh Homeopathic Medical College. A heartfelt thanks to the organizing committee of this National Homeopathic Conference 2024, Homeo Healing OH, which was wonderfully organized, systematically planned, which shows the meticulous efforts taken by the teams under the guidance of Dr. M.A. Urjankar sir. I'm really happy to be part of this seminar, this conference, wherein many stalwarts from different parts of India have enlightened, I would say, each one of us with their knowledge and wisdom on wellness in non-communicable diseases. And also, we got to know about this exit test for the young budding homeopaths, the attending at least 2 CMEs every 5 years for the practitioners and the faculties. So all in all, it was a wonderful conference arranged. Now, the food was also good. Coming to the paper presentation, I would especially like to thank the scientific committee associated with paper presentation for their continuous cooperation and support. I would also like to thank the cultural event organized. It was very graceful, and especially the girl who sang that Chaturanar. She was marvelous. Within short span of time, Kaylee has emerged as one of the good homeopathic college in Karnataka. The team, under the guidance of Urchankar sir, is really reaching great heights, and I should congratulate once again to him. I congratulate once again to Kaylee Homeopathic Medical College on behalf of our principal sir, Dr. S.B. Konkani, and my college. Thank you.
Thank you, madam, for your kind words. I now invite Dr. Rajiv Paris, Assistant Professor, Department of Organon, Arihant Homeopathic Medical College, Gujarat, to please put forward your thoughts.
Respected dignitaries on the dais, respected registrar sir, director sir, principal madam, and Shripad sir, all the principals, faculty members, students, all the members of the Karnataka Qualified Homeopathic Doctors Association, Bangalore, all the students from all the various colleges. Our organizers have focused on the theme empowering wellness for non-communicable diseases. Has really been a feast of knowledge for all of us delegates who have come from far away distances. This conference not only gave us fantastic keynote speakers, but also parallelly it allowed us delegates to showcase our work through the paper and poster presentations. The organizers have done a Herculean task of assessing these numerous deliberations by the hands of noted judges who are eminent in the field of homeopathy. I went through the 23 posters displayed outside. I really congratulate the students and their mentors and guides for putting in so much of hard work. At the same time, the courteous manner in which the students and the staff of KLE have handled this entire event is really praiseworthy. Please give them a loud round of applause, everyone. Our comparers of the ceremony also are really done a really brilliant job. Please clap for them separately. The refreshments also were abundant, giving us different sort of capacities, which we later learned today, which was wrong, that overeating is not going to bring in wellness. But still, we are thankful for the KLE to allow them, that they allowed us to enjoy the garden ambience and have a nice dinner party last night. After a very tiring day, we were refreshed by the cultural program. Thank you, students and faculty members, for organizing that for us. Now, this whole voyage, what they are saying, the conference began with very serious presentation of Dr. Naveen Pavaskar sir, showing us how we have to understand the scope first, and then how we can collaborate with super specialists, cardiologists, in order to give efficient management of cardiac diseases, which is not a child's play. Of course, next speaker, listening to Tiwari sir is a fortune for every student. Particularly what I liked is when he quoted Kent, saying that it is the trust of our patients that makes the physician take up more difficult cases and makes us work harder and deeper to encounter new challenging situations. Very true and inspiring. Dr. Nair from the NCH reminded us how we have to be thorough in our case records and how we have to run with the present time. Dr. Sanjay Gupta urged everyone to visit the council site every week, as well as other research sites, and encouraged us to do clinical OPD level research. We are very thankful to them and all the other updates which Kavita ma'am has already told you. Dr. Bhubaneshwari madam delved us deep into the understanding of how to do anamnesis of cases of substance abuse. She correlated it with psychology, with Sigmund Freud, a very novel presentation. And how we have to deal with patients who are admitted in the psychiatric ward, along by knowing the medico legal aspect of it. Day 2 of today's conference began with Dr. Praveen Jain sir demonstrating cases where paternal family history is to be considered, and especially if the mutation occurs post-delivery. This is a new learning for us, new information, thanks to this conference. Then Dr. Anup sir stressed on the value, human value of empathy, and especially to be given to the geriatric group of patients, and how it will benefit not only the patients but also us doctors in the long run. Then Dr. B.D. Patel sir showed us how lifestyle is influencing PCOS, and healthy methods of life and living alone can lead to wellness. Even medicine is not required. He warned us, youngsters, of the hazards of malls, hazards of Western dressing, eating, and talking styles. So these are all carry home messages for us. Then Dr. Nadaf madam presented on body language the important highlights in the absence of Dr. Ajit Kulkarni sir. I appreciate the coming together of all these different institutions of homeopathy. This is not often seen. The last time I saw this happen was in Rajkot on 8th of January. The seminar which was organized in memory of Dr. late Vishpala Parthasarthi madam. So kudos goes to all the principals of these colleges who have encouraged their staff and students to come here and participate. If we don't support our own event, then I don't think, I think we have lived in vain. So a special thanks also, hats off to the students who have diligently participated by sitting in this hall and motivating the speakers. So all in all, I think this conference organized by KLE is one of a kind. It's not one of the others, it's one of a kind because they have focused and lived up to the theme of wellness. Okay, and that too in non-communicable diseases, which is the burning issue of today's times. So I thank the organizers for giving me a chance to use this platform and share my thoughts with you. I'm going extremely, I got to meet my teachers, my friends, and many new people. So I'm thankful to KLE conference that you organize and then I come. I've come after 5 years. The last conference was also I attended here, but before that, in between, I haven't been coming. So so this is like prepare another event. We are all eager to join you all. Thank you. Thank you for your patience.
Thank you, Dr. Rajiv, for your extensive feedback and extremely kind words.
Without further ado, I would like to invite our chief guest, Dr. M.S. Ganachari Sir, Registrar Kahir, to the stage to address the gathering. Ladies and gentlemen, please join me in extending a warm welcome to Dr. M.S. Ganachari Sir.
Very good afternoon, everyone. Dignitaries on the dais, particularly Dr. Sripad Hegde, President KQHDA, Principal of our college, Swarupa Patil, a very senior personality in homeopathy, my mentor and founder principal of our KLE Homeopathy Medical College, Dr. Uchchankar sir, all the delegates from various institutions, students, ladies and gentlemen. Last couple of minutes, I was hearing the complete the review of the progress. I heard the feedback of the two delegates. I was overwhelmed by the entire proceedings of this conference, which was conducted yesterday and today. I know that every preparation of this was discussed with me, with Uchchankar sir. I was very keen to be a part of yesterday also, but I couldn't come because of some other official commitments. I'm sure that the way it was planned, the way it was been put on paper and how it was executed, really today I can hear that it was completely a successful program. Two things we can learn from this. The planning is very important. Validation of the plan is very important. And execution is very important. That's what I can learn from Dr. Uchchankar sir, and that he has again shown by conducting such a huge conference of getting 800 plus delegates across country. Believe me, it is not a joke. Sir has built a very good team. I congratulate the entire team of KLE Homeopathy Medical College, Belagavi. And of course, beautiful delegates. Hardly we see delegates still sitting at the last particular the valedictory lecture when I am giving. I thought hardly few people will be there, but I can see a lot of students sitting on the balcony also. I appreciate all the delegates being so kind and being the part of this entire proceedings since inauguration yesterday until today evening in the valedictory function. When sir told that please come for valedictory, I thought some couple of people will be there, but it was other way around. I can see a lot of delegates, really appreciable. From KLE, yes, always we should have to complement each other. It is a very young institution in my university, just 4 or 4.5 year old institution. Amongst other institutions in our university, we have got 56 plus year old institutions, but we are extremely happy the way how it is progressing, the way how it has been executed, and the way how the training has been conducted. It's not only the thing what we are speaking, even training has been done fantastic. And apart from those things, this conference will add as a feather in the cap of KLE Homeopathy Medical College, saying that yes, we have completed the one graduation group is coming out. And a lot of things have been pending. Already Uchchankar sir has got a long plan. Always he'll be discussing whenever we meet. He keep on talking about his profession, his college, his institutions. I think already sir has planned to start the postgraduate institutions, and we should thank our management, Honorable Chancellor sir. He has given a beautiful building. It is one of its kind building. I have seen the poster down there here. Probably in the month of June, we should may be able to inaugurate it. It will be one of the best facilities for any homeopathy graduate students. It comes a dream come to true to come and take their education in such of the magnificent building, having its own hospital as well as all facilities is near the airport. Apart from those things, I heard that all the programs were very successful. It was well taken. And upcoming days, I think Chankar sir and team will have some similar programs in upcoming. I am sure all of you will come and thoroughly enjoy the hospitality of KLE and particularly the ambience of Jain Medical College, where they are given the sufficient infrastructure, the hall, what we have been we are sitting here, the yesterday's dinner, what you enjoyed, all such things, you'll enjoy the hospitality of KLE Belagavi. I'm sure that I'll not waste much of your time because it's almost coming to the end. Wish you all the best, safe journey back home. Take good memories of KLE and try to cherish the memories of KLE in days to come. Thank you and wish you all the best for this one. Thank you. Thank you very much.
Thank you, sir.
Gratitude unlocks the fullness of life. It turns what we have into enough and more. It turns denial into acceptance, chaos to order, confusion to clarity. It can turn a meal into a feast, a house into a home, a stranger into a friend. I now call upon Dr. Supriya Kulkarni to deliver the vote of thanks.
Good evening to one and all present here, distinguished Chancellor, respected Vice Chancellor, esteemed guests, ladies and gentlemen. It's a great honor for me to express my gratitude to each one of you as we come to an end of this conference. On behalf of organizing committee, Homeo Healing Voyage, National Homeopathic Conference 2024, I extend a sincere appreciation to our esteemed Chancellor, Dr. Prabhakar Kore sir. Sir, your leadership and vision has been instrumental in guiding our institution towards excellence. I extend my heartfelt gratitude to our chief guest, Dr. Janardhanan Nair sir, President, MARB, NCH New Delhi, for gracing us with your presence and for sharing your invaluable insights and expertise during the conference. My sincere gratitude to our guest of honor, Dr. Sanjay Gupta sir, Secretary, NCH New Delhi, for gracing this occasion with your eminent presence. My deepest gratitude to Dr. Nitin Gangne sir, Vice Chancellor, Kahir, for his presidential remarks. His leadership has been instrumental in guiding us towards the greater heights of achievements. Thank you, sir, for being a beacon of inspiration and for contributing to the success of our conference. I thank Dr. M.S. Ganachari, sir, Registrar Kahir, for his constant support in all our endeavors. I want to extend my sincere thanks to all the distinguished resource persons for this conference. Dr. Janardhanan Nair, sir, Dr. Sanjay Gupta, sir, Dr. Naveen Pavaskar, sir, Dr. Shashikant Tiwari, sir, Dr. Bhuvaneshwari, ma'am, Dr. Shripad Hegde, sir, Dr. Anup Nigvekar, sir, Dr. Ajit Kulkarni, sir, Dr. Praveen Jain, sir, and Dr. B.D. Patel, sir, for sharing their expertise and knowledge during our conference. Your insightful presentation not only educated our delegates, but also inspired and motivated to delve deeper into the field of homeopathy. My deepest gratitude to the chairman of the session, Dr. B.D. Patel, Dr. Shrikant Konkani sir, Dr. Shiv Prasad sir, Dr. Anand Kulkarni sir, Dr. M.A. Uchankar sir, for giving the valuable concluding remarks for the session. My heartfelt thanks to Dr. Prakash Kumar sir, Dr. Shripad Hegde sir, Dr. Chiran sir, Dr. Swarupa Patil ma'am, Dr. Srinivasalu sir for introducing resource person to all of us. I extend my sincere gratitude to all the distinguished judges of poster presentation. Dr. Avinash Maitre sir, Dr. Yusuf Kadri sir, Dr. Milind Kulkarni sir, Dr. Nagraj Hawlat sir, thank you for invaluable contribution by giving constructive reviews and feedback to the participants of poster presentation. My deepest gratitude to judges for scientific paper presentation. Dr. Shiv Prasad sir, Dr. Anand Hosur sir, Dr. N. Madan sir, Dr. Shaila Uchchankar ma'am, Dr. Lingraj Magdum sir, Dr. Kiran Patil sir, Dr. Vijendra Itgi sir, for giving their valuable inputs and enhancing our knowledge in research and various case studies in field of homeopathy. I thank all the delegates from different parts of the country who have graced this occasion. I would like to express a sincere appreciation to our sponsors and partners, Schwabe, Weasel, Padma, SBL, IBPS, Homepath, Baxon, Harvard Pharma for their generous support, without which this event would not have been possible. I am indebted and grateful to our beloved Dr. M.A. Uchchankar sir, Director Administration of KLE Homeopathic Medical College, for being the vision seeker and a torch bearer for the resounding success of this conference. I thank Dr. Swarupa Patil ma'am, Principal, for her constant guidance throughout the planning and execution of this conference. I thank Dr. Shripad Hegde sir, President KQHDA Bangalore, and his team, his unwavering commitment and timely support which paved a way for our conference to reach this height of achievement. I thank all the faculty members, teaching and non-teaching staff of KLE HMC and technical team for their commitment towards work and for being an integral part of making our conference a great success. I thank Panchami caterers for their delicious food. I thank Ad Syndicate for graphic designing and printing work. I thank all the students of final year batch 2020 for your tireless efforts behind the scenes. Students, it has not gone unnoticed, and we are deeply grateful for your invaluable contributions. I thank Dr. M.A. Uchchankar sir for addressing the gathering. I thank Shilpa Patil ma'am for introducing today's chief guest, Dr. M.S. Ganachari sir. I thank all the students of KLE HMC and especially students who performed at for the cultural performance. I thank Dr. Saujanya Nagloti for her inaugural dance for cultural evening. I thank Dr. Rinku Porwal, Dr. Jessica Monterio for carrying out the Master of Ceremony. In conclusion, I express my deepest gratitude to each and everyone present here who has directly or indirectly been a part of this event. Your support and participation has made this event a grand success. Thank you, each and everyone. Thank you, one and all.
Thank you, Dr. Supriya Kulkarni, Madam.
As we bring this event to a close, we cannot overlook the pivotal role played by our distinguished audience. Your unwavering presence and active participation have been the cornerstone of our success today. Our insightful questions, thoughtful reflections, shared experience have enriched our discussions and propelled us forward on our collective journey. We extend our sincerest gratitude to each and every one of you for your invaluable contributions and for making this event truly memorable. Your presence has not only validated our efforts but has also inspired us to strive for excellence in all our endeavors. Thank you for being our driving force. I now request all of you all to rise for the national anthem.
After the national anthem is over, I request the staff, students, and the organizing committee to please wait back for the group photograph.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
I request all the delegates to please move ahead for the high tea in the basement.